You guys don't know what this access is going to help you so much now with your learning, because that PDF was not good. And now you can actually click on all these links and you can go to the medical side of it. Don't limit yourself to oral and dental. Try and go into these sections as well. I mean, if I were to understand a little bit more about diabetes, I'll go into the diabetes section. I'll go and read, okay, what are the different types? How does a GP manage diabetes? What do they do? Like type 2 diabetes in adults. And just kind of make sense out of it. It helps a lot. It kind of complements our dental side of things. So from a dental, we know I'm going to refer it to a GP. Then I go here. Okay, if I refer this patient to a GP, what will a GP do with this patient? If I'm suspecting somebody might have diabetes and I refer them to a GP, so how would a GP diagnose that? What tests would they do? So this is all the Australian guidelines that now you have access to. So see what interests you. You look at these. Now, these are the ones you will not find in the oral and dental section. Do you see? These are the ones that I use in my slides. And these are the ones, do you see? I've highlighted it long ago and it's still there. It stays. When you highlight it, it stays like your book. You can always come back and you can look at the highlights. All right. So that's would be something I would suggest. And with these flashcards, it will greatly benefit, like with these ones. And then I'm making a comparison as well between each, but for each antibiotic, for each painkillers, indications, contraindications, interactions, and then one big one with all summaries. So yeah, this is going to be a big game changer, I think. All right, any other question for me?
Dr. Nazia, I
Yes.
got access to ETG since last year. I bought it myself. But to access to the flashcards, I have to buy the subscription from your academy, right?
Yeah, because this is like the entire section we're
Yeah.
building.
Yeah. Perfect.
Yeah. So it's just not just the ETG. I'm sure, look, this is my own ETG access, which I bought it myself every year. My subscription is until September. But that section now is going to have so much more. I'm enriching it. So for anyone, whether they need ETG, whether they need a flashcard, whether my Power One students, they need to go and do the quizzes, it's going to be completely based on ETG.
Yeah, great. Thank you.
Yeah. All right.
Dr. Nazia,
Yep.
I have a question in hematoma. So you did, yesterday you did give the history, like, sometimes they say like, they have done the root canal treatment 3 months ago, and we are correlating that with the TMD disorders, right? So in case if we don't have any history as such and the patient comes back and still there is no improvement in mouth opening, do we still have to bring that TMD those things at the end?
So you mean saying that if patient does not have an issue with mouth opening?
No, I mean, like if he don't have any history, like he did any root canal treatment 3 months ago, but still
You might
after.
have triggered. Then you might have triggered it.
Ah, okay.
So the question here is whether it was something that was triggered already, patient had it and didn't know, or is something, I mean, anything that happens, there is a starting point. Remember in part one, there's a
Yes.
question about this?
Yes.
That, and it's given in ADJ as well, that sometimes, with these patients, we are the one that triggers it. And it's a medical legal issue sometimes. A lot of medical legal arises around TMD because it's a chronic condition.
Okay. So if that mouth opening doesn't improve, we just tell him like, it could be related to the TMD. So I would like you to refer to the oral medicine specialist, right?
Yes, so you refer them to the oral medicine specialist, and if I go back to oral and dental temporomandibular section, they've given us some instances. They've mentioned about extraction as one of the causes. They've mentioned about procedures where patient is going to open their mouth for a prolonged duration of time. Both are all there, and they're the two scenarios, don't we? We have both scenarios.
Okay.
So it's somewhere here, I think it was mentioned, contributing factors. Yeah. So that's what I would basically check with this patient. All right. And as TG says that if you are suspecting other causes, then you have to refer them to oral medicine so that they can do further evaluation, MRI.
I mean, if he doesn't give any history, like, he has done any root canal treatment or anything, I'm asking, still we have to mention about the TMD at the end?
Yes, because it's never the first line.
Okay.
See, if you look at trismus, what are the different causes of trismus, right? So from a trismus perspective, if I go back here, you have to look at the first cause, which was hematoma,
Yes.
right? This is the first cause. And that's what we're saying. We're saying, like, if that is the case, this is what we're going to do. We're going to flush it away. And let's say if you flush the blood away, hematoma is reducing. So then mouth opening should also improve, right?
Yes.
We should see some improvements to a certain amount. But do you see how ADC, they are so smart? I mean, if you look at new TG as well, they've given us 20 millimeter. And that's in TG. It says in adults, the definition of a reduced opening measure, it says less than 20. Do you see?
Yes.
And they've given us 20.
Oh, yes.
Do you see? Now, this line is very interesting because I'm just going to go to my super simple highlighter and make a quotation out of it. Do you see? Now, with this, we're at the border. Because if, let's say, patient comes in 2 days, it's 19 millimeter, right?
Yes.
Then officially, that's concerning. And it says any measurement, now this is the next line, less than 20 millimeter, which is 2 finger, indicates significant reduced opening span that requires further evaluation.
Yeah, that makes sense. Yes.
Right?
Yeah.
So then it means that the cause could be something else. And it says a measurement more than, let's say patient comes back in 2 days. Now it's 22. Now that means what we suspected, which was hematoma, we're on the right track. Monitor it. You don't need to refer.
Okay. Yes.
You get it?
Yes. It's clear now. Thank you.
Yeah, see that this super simple highlighter, this is what I do. When you use different colors, quotation marks, so much easier to kind of look through it, what they're saying to us. All right?
Yeah.
All right, so Kushi has a question about flow pattern of the class, how it goes, how we can make it more. Since I'm new to this, I'm sorry. Okay. Well, Kushi, that's a good question that you've asked. So in terms of flow, we're just about to start. So ideally, you should have received a schedule, and based on that schedule, it would have been mentioned which cases we're covering, because like this week we were doing module 3, and I'm sure on your email it would have been mentioned, for example, Monday, which cases we're covering, and Tuesday, which cases we're covering. I mean, this is just my back end that they've given it to me that I look at it. So this is goal set that we're doing. So Monday, yesterday, so I tried to cover one from cluster 1, cluster 2, and cluster 3. So these are the 3 cases we did. And these are the other 3 that we're going to be covering today. Now, it's always a good idea a week before, if you can watch the videos. Look, I keep saying to change the videos. Believe me, the amount of workload I have, I've been meaning to do it, but I will do it. I need to change. Now, the videos that are in the module section, they are outdated, and I have been meaning to do it, but I'm just trying to update as I'm learning from these ones. So in these module sections, there's a lot of videos that are a bit old that I need to change. I'm hoping tomorrow we're launching that online technical course. So I've been kind of stretched out with that as well. But this is the one that soon will change. But it's good. Again, the changes, what I have explained in these videos is still similar, but in these classes, I'm adding more to it, the latest updates. So it's still a good starting point for you to watch before the class. But what you'll also find is latest discussions that we have in our support classes. So you look at your schedule. For example, I'm going to go, okay, well, today, for example, we're doing 5-year-old with draining sinus, generalized periodontitis, Torres Islandea. So I'll go to the module section. I'll watch the videos about that. Even if it's a bit outdated, it's okay. Something you'll get out of it. Then I'll come back to the support classes. This is where we have the discussions on Tuesdays and Fridays. I'll look through it. Can I find any of those cases here? And if I can find it, I'll listen to that, right? So I think there's some new. Okay, this is the new denture case. Last Tuesday I did necrotizing. These are all the latest uploads. These are something that we had recent sessions that are now uploaded. So just go through it, listen to it. Look at this hematoma discussion, the one that we did yesterday. This is like 1 hour discussion we had. So go through these videos. You will not find it for all cases, but you'll find for the most important ones. Look at this, Torres Islander. It's there. And then when you come to the class, you have about 50% of an idea. What am I talking about? And then during the class, just write down the key information that I'm providing. This case, this is the core. So what I want you to take away from these classes is the story. The stories, you will not find it in the books. This is not somewhere you'll find it in any platform with any other mentor. You will not find that information because that's coming directly from the exam data that I've collected, and I continue to talk to the candidates. So this is where we talk about, this is like an OSCE structure. So just write down, what's the core issue? Who is this patient? What is going on? What is the focus point? And when I say that in this OSCE, we're focusing on these 3 things or 4 things, even if it doesn't make sense, just write it down. It's okay. Write it down. And whenever you go back to your notes, and when you look at it, like, well, I don't know why I wrote it down. You're welcome to book a time with me. Pile up your questions. I'm happy to have a chat with you. All right. So that's how it would work. First 2 weeks, 3 weeks is just not going to make any sense at all. And that's why my recommendation was always, which I've been speaking to most of you, and I did say that spend 4 weeks first, watch the videos, then jump into the live classes. But many of you said, no, we want to jump into the live classes. I said, okay, come. So the whole idea of the live classes here is, I try to make connections between all the cases. Maybe I'm teaching today, for example, 5-year-old. But I would, in between, you'll find that I'm going to relate this case to with another 5-year-old in module 7 because they're so related to each other. And I might make some comparisons between the two. What is the difference between this case in module 7, which I haven't covered yet with you guys? And what is the difference? What are we focusing here? So those connections are also very important. Because these OSCEs are so interrelated to each other. And so that's why having that background knowledge makes it so much easier for you to understand, but it doesn't matter. Look, I keep repeating the same stuff all the time. All right. So that's pretty much it. Okay, so we're going to get on with our schedule now. So we're doing 5-year-old, generalized periodontitis, and we're doing Torres Islander case. And who's going forward first?
Anyone?
All right. I was starting with you.
Like if anybody doesn't want to go, I'm happy to.
Sunita, you're amazing. You're gonna pass. This the other girl, she passed her exam as well. I'm sure a lot of people would see her recording in a lot of those support classes. You might her name there as well. What was her name? Sorry, my brain is pretty bad.
Preeti?
Preeti, yes, Preeti. And she was like you. Every time she would just jump in, can I do it? I was like, oh yeah, do it. Okay. Let's do it, Sunita. Which one? So Shireen says she wants to do the Torres Islander. I think yesterday Ayan mentioned he wants to do the generalized perio. I'm not sure if Ayan is still going ahead with that. If that is the case, then we're left with that 5-year-old.
Yes,
Just
doctor, I'm
ask
going ahead.
anyone what they want to do. The left I can do.
Okay. So I think the only one is left is 5-year-old.
Yeah, that's fine.
Okay, that's fine. Let's do this.
Uh-huh.
And guys, I'm just emphasizing again, this exam is overcoming your fear. This exam is overcoming your vulnerabilities. It's okay to make mistake. And I mean, like Sunita, she's doing amazing. Yes, we're making mistakes, no problem. But the confidence that she would get out of these role plays and being okay with not being okay is going to be the reason of her success. Isn't it, Sunita?
Of course,
Okay.
Dr. Nazia. Thank you so much for your support. Always motivation.
No, no, it's good. I mean, it's just you're okay with not being okay, and that's the way it is.
Yeah.
Okay, here we go. 3 minutes, cluster one.
Thank you so much. Thank you.
All right. Are you ready?
Yes, please.
Here we go.
Yeah. Thanks, ma'am, for bringing cell into my practice and for letting me to do examination. You are here regarding some discomfort and pimple on upper left side. Am I correct?
That's the thing, doctor. I am concerned about that she's been complaining about having pain and discomfort,
Mm-hmm.
from this tooth. And to be honest, doctor, this tooth was filled, not long ago, by the school nurse.
Mm-hmm.
And now she's having issues on this tooth. So that was quite concerning for me. And there's like a pimple next to the tooth. She's been complaining of some bad taste as well.
Uh-huh.
So could you please have a look and, tell me if there's any hope for this tooth? I don't know.
Mhm. Yeah, definitely, ma'am. Even I had a look. I can also see the pimple, and I was also curious to know what's going on, why it's happening. So I'd just like to have a few discussion about some aspects of it. Is that okay?
Yeah, that's perfectly fine.
Yeah, thank you so much for that. So you mentioned that you got this tooth filling to be done by the school nurse, and may I know when it was?
See, doctor, I think it was about 7 or 8 months ago, I think. Yeah, it was just within the same year.
Okay, okay. And did they give any other feedback or any other information to you as well? Any other follow-ups required or
Yeah,
what?
they did mention that she might need a couple of more fillings. There's some other teeth on the other side that
Mhm,
are turning black.
Mm-hmm.
But the thing is, doctor, I mean, I can always go back and fill those teeth, but I mean, I thought, once you do a filling, that would solve the issue, but yet these teeth were filled and now she's having problems with these teeth.
Okay, okay, I understand. So, Mom, you just mentioned about the discomfort. So, can you tell me a little bit more what is triggering this discomfort?
What is triggering? She's that she's been experiencing pain on biting
Uh-huh.
on this side. I mean,
Uh,
it hasn't been severe enough, so luckily, I didn't have to give her any pain medication. I've asked her to chew from the other side, but then
mhm.
she's also been having some sensitivity on the other side as well.
Oh, okay, okay, okay. Are you taking any medications to relieve this discomfort?
No, like I mentioned, it's like, yes, there is pain on chewing, but it's not severe enough, for us to give her pain medication.
Okay, okay, understandable. And by chance, did you notice any swelling on the face?
Um, no, 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 nothing at all.
Okay, that's good. And now or in the past, did it awaken Sally not able to sleep properly?
No, 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 she's been okay.
Okay, that's really good. So thank you, Mom, for providing this information. It's very helpful. So let me summarize that I'm right, and if you want to correct me, then you can. So Sally is having some fillings done in by the school nurse in the back tooth, which you mentioned here, and after that, she developed some pain on biting and some pimple on the gums and some sensitivity on the other side. Am I correct?
Yes.
Okay, thank you so much for that. And just one thing more, any other bleeding from the gums? Anything?
Oh, well, not really. No, nothing like
Okay,
that.
that's good.
But doctor, I mean, wouldn't these fillings were supposed to be doing the job that it should have? I mean, why would she be having pain and pimple?
Yes, ma'am, your question is very genuine, but let me explain. The fillings in the mouth, they are just a barrier, but they are not a permanent solution for the holes. If you do not change the environment of the mouth, like a acidic environment, then still the bacteria can thrive and they can make the holes again in this even filled tooth, right?
Mm-hmm.
And they can make holes in other teeth. So my aim is that fillings are not the solution for the holes. So we need to have some preventive measures.
So
What
then what's the point of then doing the fillings? I mean, then I shouldn't be doing any filling on the other side either.
You are right. When there is a issue of the holes, we need to do two things. First, do the filling, and simultaneously, we need to change the environment of the mouth. What is causing these fillings? We need to change that. So, just drilling and filling is not an option. We need to change the lifestyle. So, I'm curious to know what's going on that even filling has failed here. So it can be because of let me explain about the how holes happen. Like first it is bacteria. So may I know how often Sally is brushing her teeth?
Well, she's brushing once a day.
Okay, and is she able to clean in between the teeth by using some tools?
No, I haven't given her anything.
Okay, and how regularly she is attending her dental appointments?
Well, if you talk about official appointment, this is going to be her first. But
Mhm.
she's seen the school nurse, as I mentioned earlier.
Okay, I mean regular checkups and checkups appointment. Is she attending?
No, no, no. I
Okay.
mean, this is the first year she went to prep and they had this first year school checkup. So that's how I got to know it.
Oh, okay. That's good. As long as we are starting, that's good. Mom, actually, in order to have a thorough cleaning in the mouth to avoid these bacteria feeding on the sugars, we need to brush 2 times a day along with cleaning in between and have a regular checkups every 6 months so that anything going in the initial phase can be fixed at that point only, right?
I mean, I get it, but then, doctor, would you be able to save this truth for her?
Yes, ma'am, I can totally understand your query regarding this concern. Ma'am, I need to do my thorough examination and do some investigations, then I can better answer your questions. But Unfortunately, by looking at this tooth, I feel it's very difficult to save this tooth. Let me complete my investigations first, then I can answer that. Is that okay?
Okay.
But, ma'am, may I know why we are not able to have regular dental appointments?
Well, see again, doctor, it's not easy. Look, again, dentists are quite expensive and me and my husband, of course, were working day and night. So it just never occurred to us, we thought,
Okay.
something can be done later.
I totally understand, ma'am. So, in order to support your query, my practice manager will let you know about some plans led by the government if you are entitled for that. So, my practice manager will help you to discuss that with you. So, may I know a little bit more about the diet? Is she a lot of fond of like multiple lollies and gummies?
Oh, no, no. Look again, doctor. This is what I do. I give her a very, clean organic diet. She's not like regular kid that snacks on those lollies, chocolates. I wouldn't even give her.
Oh, that's really good. I appreciate it. May I know a little bit in detail about what organic healthy diet you are giving for my
Like
big?
everything is completely home-baked. I mean, no matter how busy I am, I would still, bake things for her. She loves having those home-baked mueslis, bars. She loves having, even for snacks at school, I give her those dried apricot sultanas. She loves it.
Oh,
And
okay.
that's pretty much I would be giving her. And I don't even use sugar. We use honey. It's
Oh,
everything natural.
oh, that's good, mom. You are trying to give everything on it, but the bacteria in the mouth, they do not differentiate whether it's a natural sugar or it's a processed sugars. The sugar which is used in making muesli bars, so and sultanas, so they bacteria feed on them to produce acids. So here, moreover, the sultanas, they are a little bit sticky and they remain in contact with the bacteria for a long time, and more acid is produced, so more loss of the tooth structure, right?
Okay. So does that mean that? So, but what are we gonna do about it? What are you gonna be doing for her today?
So today, I'll give you a diet chart to fill. We will discuss what we need to do
A diet
simultaneously.
chart.
Yes, for the next appointment. Today, let me complete my investigations first. So I'll be feeling any lumps and bumps in her neck, any fever. I will check, and then I will check all the teeth present, any wobbly teeth. I will feel around the gums as well. And for this particular tooth, I'll very gently, if she allows me, to tap on the tooth. So it seems to be having a dental abscess, but I'm not sure, very sure, coming from this tooth or the adjacent tooth. So to confirm that, I'll be taking a small X-ray. We call it as IOPA. And then it very seems to be less likely coming from the gums because she's a kid. And then I can address your questions better. Right?
All right. That's
Any
good.
questions for me?
All right. Thank you so much. Well, getting
Oh,
better. I love the statements you were making in between. That was amazing.
really? Thank you.
All right. How did we go?
Uh, I don't know, Nazia. Like with you, whenever I practice, I'm not able to complete my scenario. I messed up the things. Like, irrespective how many times I have done that scenario, I mix up the things. I don't know
Look,
why.
again, that's how the conversation would be in the exam, and I can see that you are not fixated. So at the end of the day, remember, this is a job interview, okay? They are
Yes.
using these cases to see who you are as a person. So what
Mhm.
that tells the examiner that you would prioritize, of course, patient over what you needed to say. And yes, you have clarity as well, which is very important.
Mhm.
Um, so yes, you were eliciting my concerns, the reason why you explored the barriers. So that was amazing. I think the only thing we missed out was the complaint uh,
Oh,
part
yes.
of it,
Mhm.
right?
Mhm.
And so let's go through it one by one and then look at it. But overall, look again, this was really good. I mean, even though we had 45 seconds left, I think you still managed to discuss the important investigation. So I've got a good timeline in front of me, and I'll kind of guide you on where we took a little bit more time than needed.
Just
And
tell
where do we
me
kill
the
our time?
mistakes which need to, because everybody knows what needs to be done. But because of lack of time, we always need to do what are the very important things we cannot miss. I think we need those points that we cannot miss on those points.
And one of the ways I would recommend you guys doing is never practice OSCE as a 10-minute. It's a big mistake. Okay. Now, when you practice with your friends or with yourself as a 10-minute, you don't even realize where you're killing your time. But when you practice, this is what we psychology, when we are teaching, I've got quite a bit of experience with psychology. That's why I bring that into teaching. We call backward and forward chaining as well. So when you want to teach somebody a very complex task, you need to break it down into small bite size. And you have to, like, it's a 10 minutes. So 10 minutes, we're going to break it down into sections. And each sections, you need to practice it. You need to master it before you move on to the other one. And oftentimes, the areas where we kill our time is when we are explaining the risk factors or when we are giving the diagnosis or provisionals. This is the box. These are the two areas, problematic areas, because this is where the examiners are not interrupting. And when we get carried away with a lot of words, all right, that's where it becomes problematic. Okay, so what do? Keywords. Always keywords. And just remember, when they're marking you as well in the exam, on their iPad, they have keywords. I'm just giving you an example from my ORE from UK. If you see this was a case about dry socket, do you see? There's just keywords, right? No long structures. Sometimes people come back and tell me, "Oh, I'm conscious about my English. I'm not good." I said, "Well, it's even better. Don't talk too much. Talk less. Keywords. The shorter your sentences are, and the more rich it is with those keywords, the better you will perform in the exam." Okay, and so we did really well. The style was amazing, beautiful, beautiful style. So what's the story and what's been going on in this case? So, we did a caries risk assessment last week. It was about an 8-year-old boy, and it was not just any boy. This boy was coming from a single parent, whether it was a single dad or single mom. And on top of that, apart from being single, the other issues that you would deal with that in that case was either they were immigrant or they were refugees. So that adds an extra layer of difficulties accessing the healthcare or knowing. I mean, for you guys as well, coming to Australia, it will take you a couple of years to understand how the entire system works. So that was the reason why that child was at a risk. But given the age, 8 is an age where we could work with that child and make him more independent as well. Now, this is a 5-year-old. Now, there's no way I would expect this 5-year-old to be doing everything. Like, she needs supervision, she needs more support. Mom and dad or other caregivers, whoever is responsible, they need to be on board with us as well for this to work because she's a high risk. But the question here is, why is she at high risk? What is going on in her case? So now, when we do these cases in the exam or in the classes, what I love doing is making connections. And this case is so similar to the one that we will cover again in the silver set. So in the silver set 5-year-old, we're dealing with acute abscess. And this one that we are just doing today, it's a chronic abscess. It's a chronic infection. That's why it's draining. And that's why there is no pain other than just pain on biting. Now, abscess can happen for many different reasons. And that's a very important assessment question that they want to know. Why did she end up with an abscess? Why did the filling fail? Now, what is mom thinking? So again, we go back to ideas, concerns, and expectations. So mom's idea was that once you do a filling, you're done with that tooth. You don't have to go back to that tooth. And a lot of people think like that, right? Once you do a root canal, they're like, that's it. Once you place an implant, they think that's it. It's there for life. It doesn't work like that. So the whole idea of these treatments is to fix the damage. Like, for example, if you've got a hole in the wall, the first thing, logical step is to cover it, patchwork. But then the next step is more preventative because we don't want more holes in the wall. Same thing in the tooth. So now, whether this was communicated to mom or not, whether she knows, that's one question. But her perception is that fillings maybe, were not. So the fillings are, once they're placed, you're done. And second, her concern was, what if that the care that my daughter received by the school van was not good? And what if, and if it's not good, they would normally, so there's the way it works. So currently we're also partnering with 2 major mobile dental services that operate across Australia. So hopefully, uh, it will greatly benefit if you guys need a bit of job or exposure. We can guide you through that as well. So we're working with some of these mobile dental services. Now, what their job is, their job is to go to schools. Some of them different when the companies are. Some of them they go to childcare, daycare, schools, and the parents normally will receive a letter ahead of time, and they need to consent if they want their child to be seen by these school vans. And if they will do a checkup, and normally either there will be a dentist or oral health therapist. All right, so not always dentists are there. Sometimes there's oral health therapist as well, and they're the ones that does filling. But how do they fund it? Let's say if after examination they notice a child needs any sort of treatment, and if a child has child benefit scheme, so to be eligible for child benefit scheme, I want you guys to please read about it. Understanding the system is an essential part of OSCE because they will cross-question you. So child benefit scheme, not every family is eligible. So the parents needs to meet a certain threshold. If both partners, their combined income is less than that threshold, then they would be eligible. And as part of child benefit scheme, they get a certain amount of rebate from the government. I think it's about 1,100 or close to 1,200. And it will, I think they've raised it. Previously it was 1,095. Now they've, I think, moved it a little bit 100 extra. And then they would use those that child benefit scheme, and under that they can provide them some treatments. Now, what treatments are usually covered? Checkups, X-ray cleaning, fissure sealing, fillings as well, or extractions. A lot of those important procedures can be done. Now, in this child, maybe 6 months ago or 8 months ago, when they saw, and those of you that have recently done part 1, I'm sure you would know about indirect pulp capping. So we don't want to unnecessarily expose the pulp where possible. And so maybe in that school van, they decided that it's not directly going into the pulp. Maybe it was deep and they just filled it, hoping that it wouldn't get worse, hoping that, it would work. So what does Cameron says in that situation? Cameron says that regardless of what you do, direct, indirect pulp capping or anything, in primary or young permanent teeth, follow-up is very important, right? So they did recommend, that was a very good question Sunita asked me, was were you given any recommendations about follow-ups? And I did say that yes, they did suggest to, see it, come back or see a dentist for some other fillings that were remaining. Now, this is the next question that you should be asking then and there. Like, so why did you go? If not, why you didn't go? So with that why, we're exploring the barrier, because whatever advice you're going to give, they're going to use the same excuse as well, not to see you again as well. So knowing the barrier is very important. Now, any tooth that is classified as high risk or where we do those bulk treatments, it's important that they have follow-up, because there are chances that it can fail and the tooth can still become necrotic despite doing indirect pulp capping, and which might have happened in her case. So that indirect pulp capping could have been the right decision, they didn't do a root canal. They gave this tooth an opportunity. But yet, despite that, it failed. And what we're looking at is pain on biting, draining sinus. And this is also a very important question they ask is, can you save this tooth? Now, because this is a chronic infection, and chronic infection, oftentimes the bone is eroded. There's no hope for that tooth. It needs to come out. So yet they are kind of asking, can you save it? And yet in the silver set that we will do later, it's an acute infection where it may be possible, even though with abscess, better to remove it, but sometimes it can still be possible in acute cases to save it, but in chronic, there's no hope. So they do the reverse psychology. So where you need to save it, they say remove it. And in this case, where you're supposed to be removing it, they're asking for you to save this tooth. Yes, I cannot give a definitive answer without taking an x-ray, but they still want to know your clinical reasoning. Do you understand that in chronic infection, the intraradicular radiolucency, the bone is eroded, better to extract it. But x-rays will help us confirm. Now, mom doesn't know that. Now, the question here is then why did that indirect pulp capping fail? The reason why it failed was there was some leakage around the filling. The environment was not fixed. Now, that is the most missing piece of the puzzle. It's like diabetes, KDs, perio. There's no cure for these things. It's just something we have to be able to control. So this is really good from McDonald. It says we also need to emphasize that treating. So this is about educating the parent, questioning their perceptions that restorations, they only fix the damage. It does not cure the disease. So if you want these restoration to survive, and if we don't want more restorations, we need to fix the environment. And what was going on with the environment is where the assessment is. So what was happening here was that there's always three things to happen. Now, in this case, as I mentioned that diet. Now, fast. What is fast here? Mnemonic. So frequency, acid, sugar, texture. So these are the four things that we always ask. Frequency, acid, sugar, texture. Now, sugar is always there. I'm not surprised. Texture was important in this case as well. And also, this was very important, acids. So when you ask them, so how, mom, if you can walk me through her diet, what does she like to eat? And they would say, oh, well, look, she likes having, I give her very organic diet. I home bake. So in this case, they always emphasize organic home. And a lot of people, they will just move past, oh, well, that sounds amazing. And they go. But yet, that's what Sunita did amazing was she paused and she's like, okay, could you please tell me what does that organic diet looks like? So guide them what you're interested. I'm interested to know more about if she's having anything that is sweet, anything that is sticky, or any drinks. What does she like to drink? So you'll find that I gave a lot of sticky things. I gave honey, sultanas, dried apricot, and muesli bar. Well, what I did not give was the juices. All right. And either in the exam sheet was having orange juice or apple juice. Sometimes they say, oh, we've got this big farm and we are the biggest supplier in the Southeast Australia. We provide to Woolies, would you like to have a jug of juice as well? They might offer you. So I wouldn't turn that away. I mean, that's a good offer. But that juice is apple and orange juice. And a lot of people, families, they think they're healthy. I mean, but they don't see what we know is to educate them that having a fruit is better than a juice because juice is a concentrate and it has natural sugar plus it's very acidic, which she doesn't know. And frequency was high. And that was very, very important for us. Water-wise, always remember saliva is a band-aid. The job of saliva is to, repair the tooth. So we need to know, if they're drinking enough water, what type of water they're drinking, because in a lot of communal communities, regional areas in Australia, it's not possible for the government to provide them, communal water, community water. So, and it does rain a lot, so they might just have these big, huge tanks that collects the rainwater, and they might be using that. So it's very important. You need to always ask in pediatric cases 2 questions about water. What type of water are they drinking? Is it tap water, which is the communal, or is it the tank water? Tank is rainwater. Rainwater, of course, doesn't have fluoride. Now, in this case, there was just one version where they said tank water, but usually it's tap. And 2, are they drinking enough? Because usually if they're not drinking water, there's something else they're drinking, and something else is oftentimes the juices. So it's very important to ask, what does she like to drink? And with what does she like to drink, or you will find out that there was more apple juice or orange juice, and there was less water. So very, very important to identify this. And what else we could ask in this case was, so basically, there's nothing in the medical history. Medical history generally is very clear in this case. So the ones that I've highlighted are very, very important to know. So in the beginning, ask them about, so mom, tell me more about your concerns, or tell me more about what she's been experiencing. And as I said, doctor, she's been having pain on biting, and these teeth were filled many weeks ago. So, so I was a bit concerned, and that's why I brought her in. And whenever they share these with you, quickly appreciate, I'll say, well, thanks for sharing your concerns with me. So when you say she's been having pain on biting, like how long, how long has it been going on? And if there's anything else that is also making it worse. So I mentioned no, it's just pain on biting. Yes, she does have sensitivity on the other side for sure. And then I did say that, but the pain is not bad enough for me to give her painkillers. So good, relieving factor is done. I did also mention about the pimple and the discharge. So I'll ask, so with that pimple and discharge, when did you notice that as well? So I want to correlate it. So they say, oh, well, it appeared like 2 weeks ago, doctor. Okay, all right. And did she, now you mentioned about the filling being done. Now, what was the reason for the filling that were placed? I want to know. And they say, oh, well, I don't know. I mean, they just had some checkup and they decided to place some fillings, and that's all I know. I'll say, okay, well, did you get any recommendations, any suggestions about what needs to be done next? And as Sunita asked me, I said, yes, they did suggest she needs some filling on the other side. And then I'll say, then what did you do about it? Well, I didn't go, I didn't follow up. Then I'll ask, well, what was the reason for not following up or not? Then she says, that's where I brought the cost issue. Well, I couldn't afford it. Sometimes there's cost issue, sometimes there's where they live, it's far. There's no dentist in those areas. And it is true, believe me, there's a lot of communities in the regional area that are struggling. There's not many dentists in those areas. And that's why, they have to travel 3-4 hours just to see one dentist. So that's sometimes they might tell you about it as well. So then we say, oh, right, well, that seems to be challenging, for you. Then how has she been keeping up with her oral hygiene? How does she clean her teeth? So I did mention she's brushing once. Now, what about cleaning in between? None of these kids are cleaning in between. I'm not surprised. What I was mainly interested was supervision and toothpaste. So B, F, S, T. B is brushing, F is flossing, S is supervision, T is toothpaste. So I'm not surprised all these pediatric cases where they're brushing once and they're not flossing. This is not unusual. All cases, you'll find that. I mean, if they're brushing twice, it's amazing, but that's a bare minimum you should expect. But what you need to focus on is this child being supervised? If not, why? That's where the question is. So now she was not being supervised because mom and dad were too busy. And then toothpaste. Now, she would be using a kid's toothpaste, which has 500 parts per million fluoride, or sometimes she's using a herbal toothpaste, which might not have any fluoride. So it's very important. to know what type of toothpaste she's using. High risk, we need to move them to adult toothpaste, fluoridated adult toothpaste. So supervision toothpaste, incredibly important questions. Why was the filling placed? What was the recommendation given? Why isn't she being supervised, or why didn't they follow up with the recommendation or take her back to the dentist? This is extremely important questions. And then in terms of diet, what is she drinking? I'm interested in those juices. I'm interested in texture. And also, if anyone in the family, new TG talks about caregivers' experiences as well. They say that you need to also make sure that, because if the parents, they have, this is TG, they say that additional risk factors in children could also be in caregiver, because sometimes they might have genetically deep grooves, or even it carries, it's just the diet in general. Everybody's eating it. But if you missed, that's not a big deal. Do not miss texture, juices, because juices is the one that worn down the fillings. Now, what should we do after you finished your history? If the examiners are not interrupting, I'll finish my history in 5 minutes. It's a cluster one. But if they are interrupting, which I was, I love the fact that Sunita was responding to me. So within a minute, the first assessment question that I asked was, well, doctor, I don't understand why these fillings, are failing. Aren't these supposed to be doing the job? So what I wanted to know was, how is she going to go about answering that question, right? So you need to answer those questions and bring them back to your structure. Now, so what she did was amazing. So I would go, I say, like, Mom, that's a good question you've asked. Now, yes, look, fillings, basically, the job of filling is to fix the damage if there is already a hole present. So it basically goes in there and to fix it. But it doesn't mean that these teeth wouldn't have problems in the future. But I'm also curious to kind of understand a bit more about, your worries and, what's going on in your mind, or what are you thinking? So I'm trying tapping into that complaint part or concerns that she has. She's like, well, look, doctor, see, I've got some fillings, and my fillings are okay, but yet hers are failing. So that was something that was worrying me. Now, with that question that I asked, you see, patient will voluntarily give me a family history, right? Well, now mom is bringing her experiences. I have feeling, my feelings were fine. Okay. Well, so mom, well, that's, yes. I mean, of course, it's good that your feelings are doing okay, but in her case, maybe it could be the environment, something that might have led to the failure of these feelings. So that's what I'm very curious to understand more about, what she's been eating and how she's been looking after her teeth and why these fillings were placed. So would it be okay if I asked you a few more questions? Bring them back. Answer that question. And then I gave a heading. I said, these are 3 assessment questions, areas, and I'm interested in these 3 areas. You answer these questions for me, please. Now, whichever way you go, it's up to you. Okay? So this is how you need to do it. Make sure that you are clear on what questions you're asking, but at the same time, have the flexibility. If they're asking you a question, answer that question and don't pause. Bring them back to your structure, because those questions are 100% related to this. So then we move on and we say, like, Mom, now, given that you've mentioned, now what you do is when you're practicing at home, put a timer on 30 seconds. 30-second provisional diagnosis, and then another 1 minute for risk factors. So all in all, this section should take you about 1.5 minutes, maximum 2. So I'm talking about this section where you're giving sign and symptoms 3 points, provisional 3 points, that's 6. Then your risk factors. So risk factors in cluster 1, roughly it's about 15 points, 12 to 15 points. So 12, 15 points, another 6, we're talking about 21 points on an average. So how much time should I invest? 2 minutes. In 2 minutes, you can get 21 points if you use the keywords. How do we do that? So we say, all right, well, Mom, now coming to your main concern, as you mentioned about these fillings failing. And there's a gum ball right next to her tooth and a pimple. So what we're looking at, something possibly, we call it a dental abscess, which I will confirm by running some tests. And it's more so like a chronic infection that has been there for a while. And given that her fillings are already starting to fail and she's got some other holes on the other side, I do believe she's under high risk. Now, what I want to walk through with you is what puts her at a higher risk, right? So would you like me to explain? Mom says yes. Okay. So Mom, I'm sure you would know that we have all different types of bacteria in our body, including our mouth, and these bacteria, they love sugar, and the only way we would minimize their amount is by brushing. That's the reason why we suggest brushing your teeth twice a day. So you mentioned she's brushing once, she's not using anything to clean in between, and you mentioned that she's doing brushing herself. So what if there are areas she's missing, and there are areas where bacteria are growing? And when she has those, you mentioned about she loves having sultanas, apricots, and honey. Now, as much as they sound amazing, but they still have natural sugar, very sticky, stays on the tooth longer, so bacteria can feed on it. And also, you mentioned she loves having juices, orange juices. Again, it has natural sugar, and when you give them a juice, it's more acidic. So whether the acids released by the bacteria or the acid in the juices, if she's having frequently, it will wash away the filling on the tooth. And maybe there would have been gaps where it allowed access to these bacteria, and then the infection developed. And since there was a filling on top, there was no way for this filling to provide a pathway. So that's why the pus came out from the gums area. So that's where the thing we need to work on, Mom, is how can we bring her risk down, and what are going to be doing for her today? Keywords. If you use keywords, you should be able to finish in 1.5, 2 minutes. If you don't use keywords, long sentences, this is where you're losing time, this box. So work on this box. Do it separately again and again. Easy to practice 2 minutes, then 10 minutes. Then investigation. How much time? I would take roughly about 1.5 minutes or maximum 2, but 1.5 minutes is good. So Mom, what we like to do is, since I'm seeing her for the first time, a thorough examination. And I want to make sure that she doesn't have any swelling on her face, underneath her neck, any fever. I'll be also looking at all of her teeth inside her mouth, since you mentioned she would need some more fillings. So I'll check how many teeth are there, missing, filled, decayed, check the color of her gums. I would also be feeling, with my fingers right next to the tooth, since you weren't sure about the swelling. So I'll feel around those areas. I'll touch her tooth to see if it's tender or not, if this tooth is mobile or not. And since you mentioned there's some teeth on the other side are also sensitive, some lose some air, to see which one it is, because then that's the one that we also need to treat. And more importantly, Mom, this is just basically to see what is visible, but to look within the bone, I need an X-ray. So 2 X-rays I would recommend to take. It's one bite wing on each side, which will help me to see the top and the bottom teeth together. And also a periapical, which is 1 X-ray of this tooth in particular. So we can see the tip and decide on the management, but most likely this tooth will need to come out. And then I'll pause again. Any questions, Mom? No? Okay. So, Mom, what we might want to do is give you some brochures to read. We need to bring her risk down. And how do we do that? Again, just the way that we did the caries risk assessment, 3 bubbles, your preventive advice will follow. And when I get to substrate, this is where I hand them a die chart. So we say, now, Mom, so we need to work together. We need to get her to brush her teeth twice a day. Very important. We can introduce some interdental brushes that she can use to clean those floss that comes with holders for kids. And Mom, she's still 5. She would need your help or your partner. And I know how life can be busy, but would you be able to take turns and help her, support her, and give her, maybe start looking into using an adult toothpaste? This way we can minimize. I would also be applying some fluoride varnishes on her teeth to strengthen it, and if there was deep areas, some fissure sealants. And last thing, mom, I would give you this star chart to fill 2 weekdays and 1 weekend. If you can bring that in, we should be able to have more discussions about and specific advices in terms of what she's eating. And if now complaint can occur anywhere in the conversation, if it does, tackle it then and there. So for complaint, I can't give you a very specific spot or time when should you be talking about it. But there is a complaint in this case where patient wants to complain against the parents. Clear? So the takeaway here is, why is this child at high risk? Well, the reason why this child was at high risk was because of the organic diet she was eating. Mom and dad didn't know about the harms that organic diet was doing. They were just looking from the nutrition point of view. And how did we know she's at high risk? Her fillings are failing. That was the sign for us that she's a high risk. And then third thing is explaining it to mom, educating mom that fillings are not for life. And yes, if she has concerns in terms of the care, there are ways we can help with the dispute management, but mom has bigger responsibility. And then if they can't afford, there's always government funding. And pretty much that's about it in this case. Any question?
Dr. Nazia,
Yeah.
I didn't understand very well the part of complaint. For example, if the mom is not happy with the treatment that she was provided at school, but the problem here, it's not the feeling. The problem is that she has a leakage because the environment didn't change. So we still have to explain why it failed and also give her the how she can complain. Like, how do we tackle that?
Yeah, so, well, this is basically ADC guiding us that no matter how good your treatment is, if you do not educate the patient, they will come back and complain against you as well. So this complaint or this is more about communication gap. How was it communicating? Did they emphasize on the importance of it? Did they address the barrier? So that's what we're trying to understand. Was it negligence? Was it the care was perfect, but they did not communicate with the parents well enough, right? So that's one aspect. But at the same time, I cannot disregard where if somebody is feeling that they have received a substandard care, I still need to guide them because this is what your rubric says. Structure responses to patient in the light of patient's perspective. So if they have concerns about the care, so I just need to guide them how to resolve it as well.
Yes, and in this case, how is that like? Because it was organized by school, I didn't understand that part. Like, how do we talk
Complaint.
with that dentist exactly,
Yeah.
or how
So
we guide them?
the first step is to identify the which organization was there. So I'll say now, mom, the other issue that I'm also looking at is the concerns that you have about the care, she received. Now, oftentimes the best way is to reach out to the company or the service provider and find out more details. If you can also prove, if I have your consent and the name, I can reach out to them as well and get all the records. And I'm sure they would have policies in place where you can raise your concerns directly with them, and they should be able to give you some explanation. But if you're still not happy, yes, there are other avenues. I'm happy to guide you on that. But I think talking to them is the best starting point. So they would know, right? It's just, like for example, one of them is look at this. These are the different Victorian School Dental Services, School Dental One. Now we are working with Mobile Dental Service Australia. We're working with them, we're partnering with them. The other one we're working with is Australian Dental Foundations. They are operating in South Australia and all across Australia. So they are major companies that we're working with. So it's easy. So when they come, they give brochures. All they need to do is contact the company and get information.
Perfect, easy, thank you.
Dr.
And then another question, sorry,
Yeah.
last one. About the juices, how do we, what's the preventive advice, like specific for the orange juice or apple juice? Like, how do we control that part?
First, I will understand why they give it. Do they give it because of the flavor? Do they give it because of the health? You know, many people think from a health perspective, they think it's very healthy, right?
Mm-hmm. Yeah.
And we know that it's not. Fruit is way more better because we need fibers.
Yeah.
Good for chewing, good for stomach, right? We're not pouring all that acid, but many parents doesn't know. So before, always remember, any OSCE, any case, we do not give advice unless I know their what do they think. So I'll
Mm-hmm.
say when it comes to juices, we need to think about ways we could minimize that as well. But I'm also interested to understand more about why do you give her juices? And that's what they say in the exam. They say because it's healthy. So we say, well, look, I think giving fruits are better than juices because it has fibers, good for teeth, you can chew, good for your body. These juices are concentrate, very acidic.
Perfect. Thanks.
Dr. Nazia,
Mm-hmm.
they just gave a history, like I went for fillings and they are failing. So from that point, how we will bring this complaint part, because they are not showing any dissatisfaction from the treatment. So how we will bring this complaint into the script?
So I gave you two opportunities. So one was there, the first in the beginning that I did. And then in between along the way, but I said, but look, doctor, I mean, just still, not sure why would she be having, problems with her teeth, these fillings. Very casually I asked, right? So they will oftentimes give you two chances, to bring it. So whenever they do, just grab that moment and just say, look, this where you coming from. I understand, as you mentioned about the fillings, fixing the issue, but I also see that you are quite concerned about the care she's received. Am I right? Right? I'm just throwing at a question. Buddy, tell me if you want to know about complaint. I'm ready to tell you, guide you. Patient says, well, yeah, I mean, it's quite obvious, I'm just concerned about it. I'll say, okay, well, do you think it would be a good idea for you to reach out? Do you know which company it was? You could reach out to them and have an honest conversation about how you feel. Or if you can give me consent, I can also contact them. Do you see?
Uh,
That's just a starting.
But Dr. Nadia, here, we can relate as a dentist that the mouth environment has not been changed. So still, we will ask them to, yeah, definitely they can contact, but we know like the environment was not fixed and it was just filled. So still, do we guide the patient towards complaint? Because here we can relate that what's the fault here? Like risk factors have not been addressed. So still,
Yes.
do we need to guide them towards complaint?
Now the issue here is, as a dentist, right? But did they, the company or the dentist, whoever was, did they explain it to the patient? See, at the end, when we talk about communication is not what you say. Communication is what the other person receive, what they understand. It's like talking to your child, right? Like talking to a baby. Have you seen, you're talking to them, but they don't understand, right? Understanding is the main issue. Was that communicated well enough? And oftentimes complaint comes from there. The communication was not done, the brochures maybe were not given, somehow the importance. So what I'm encouraging them is the missing part is let's build that communication gap. Why don't you go back and talk to them? Tell them how you feel. Tell them about your concerns. Do you see? I'm opening that negotiation road again rather than this patient giving a bad Google review, talking bad about that company. Wouldn't it be better if they go directly to them and open that door of conversation?
Uh, uh, I feel I might be wrong as well when they
Mhm.
mentioned that they asked to follow up, but we didn't went. So at that step, can we guide them to contact further then and there only? I
You
think.
can anywhere. It doesn't matter. You can bring it out at any point of time. But the question here was they did ask about follow-up, but did they explain that these two, remember I showed you that these pulp therapy teeth, they can undergo necrosis. Was it communicated to this patient or not? You see?
Mhm.
Was this mentioned to this patient? Now, remember how I said they told me to come back, there's some other fillings required, but I was concerned pulp-treated teeth can become necrotic without any clinical symptoms. Was this communicated to this patient or not?
Okay.
Because what did I do? I distracted you with the other teeth,
Mm-hmm.
right?
Mm-hmm.
But parents' concerns were here.
So can we ask, did they said something about this particular tooth?
Just say that. Well, Luke, did they discuss about any follow-ups, any further steps required to be taken? Just open-ended question, and they will say, well, yes, they did mention about some fillings on the other side. Okay. So that's how we would go. So very, very important complaint there. Now there was a guy, he failed this case. Reason being, he did everything amazing. He spoke about caries risk assessment. He spoke about juices, textures, but he still failed. And this guy had 4 A's in part 1. So remember, your part 1 doesn't mean that part 2 is going to go smooth as well. So, and he failed a lot of cases. Now, the reason why when I went through with him, number one, when he gave preventive advice, it was very doctor-centered, did not address. So he got the version where they live far from the nearest clinic. There was no cost issue, but they had this busy farm. They were the owners of that farm. So they were working quite longer hours. They didn't have time to bring. So that's where he needed to negotiate that. Look, I understand that, during the weekdays, you might have a lot of work commitments, but did you know our clinic, we're open on Saturdays as well. And there's a few dental clinics that are open on Sunday as well. So, just let them know that we're there, but there's another clinic not far from here. They're open on Sundays. So that shouldn't stop her from getting the right care. I would encourage that. So that's one part he missed. Second, he missed the complaint. This part he missed, and it was gone. So he lost in the global marking, basically. All right, so they are asking why there's a pimple. I'll just take 2 more minutes and we're going to move to the other case. Sorry, they were asking, so why does she have pimple around her gums? So this is a very important question. Why does she have that? So it's there because there was a filling that blocked the pathway. So the pus had to drain from somewhere. So, it found through the gums. And then they wanted to know why her fillings are failing. Then they were asking about why juices are bad, aren't they nutritious? And then they were also saying, but I thought honey sultanas are good because they're natural, so we have to explain, educate them. Now, mom also says that some versions they will out directly. This examiner said that, well, look, doctor, I'm really concerned about the care. How do I make a complaint against the dentist who did that? So if it's direct route guide, then please make sure about complaint. You're very clear about the system. Then they were asking about, so doctor, can you please save this tooth for her? What will you do for her today? So for her today, remember, there's no urgent treatment required. I mean, it's a chronic infection. If she's cooperative, after taking an X-ray, I'll probably remove it, but she would need a space maintainer there. Would you give any antibiotic? No antibiotic. It's already draining through the sinus. There's no need for any antibiotic. Now, do not tap the tooth. Tapping the tooth is not a good idea because usually sometimes with chronic infections, the apical part has already resorbed. And whenever you're dealing with abscess cases, sometimes, it can be painful as well. So you can just, touch it, palpate the area, see if the tooth is a bit mobile or not. So that will be because they were tapping the tooth, they were causing a bit of an issue. And they were asking, I don't even know why was she fillings were placed, and there are 3 versions in the exam. You see a draining sinus on 6-4, and she had multiple fillings in her teeth. The other version was that she had composite and GIC filling done by the school nurse. So that means it was deep indirect pulp capping. And the third one was she had deep filling done by the school nurse, regardless. So it was indirect pulp capping done on this tooth. That's it. All right. So
Dr. Nazia.
Yes.
Sorry, I had one question. So
So,
I have this doubt about when we ask them, is she drinking enough water in pediatric cases? So is there a standard that we're looking at, just in case they ask us about it?
look, a child should ideally be drinking 1.5 liter, right? In schools as well. Do you see how they encourage them to drink?
Mm-hmm.
Right? So it's just good for overall. Is she drinking enough? Or you can just simply go and say, what does she like to drink? What's her favorite drink? So that will guide you whether she drinks water or whether she drinks juices.
Sure. Thank you,
Okay.
Dr. Nazia.
Yeah. All right. Let's move on to the next one and I'll continue with the questions later on. Yes.
Hello, good morning.
Yes.
I
Good
wanted
morning.
to ask
Yeah.
regarding the core issue slide of the previous case.
Mm-hmm.
Um, the
Yeah.
acronym ICE, could you please explain what that means?
So ICE is ideas, concerns, and expectations. So this is like a general consultation tool that they use in a GP practice. And, so I've kind of embedded that. And this is what they say here. Do you see? In rubrics as well, elicit patient circumstances, belief.
Mhm.
That belief is ideas, concerns,
Mhm.
expectations. Do you see?
Yes. Okay. Thank you.
Anyways, okay. Ready to start with that case of generalized periodontitis?
Yes, please.
Dr. Nazia,
Yes.
sorry, can I go next because it becomes a bit noisy here, if that's okay?
I understand. I know you were traveling
Ayan,
as well.
is that okay? Oh, Ayan is traveling as well. All right. Ayan, you go, please.
Sorry about that.
No, that's fine. That's
I'll
fine.
be very quick with the feedback. Okay, I won't take too much time.
No problem at all.
I'll take very quick. All right, so if you're ready, it's a cluster 2, a diagnosis cluster. And diagnosis cluster, we're looking at these 6 points. And of course, your critical thinking and help promoter. So here we are, 3 minutes. Here we go.
Thank you.
Dr. Nazia?
Yes, Sunita. So you can type your question. I'll definitely be in the chat now. We'll see the reading. All right, if you're ready, we can start.
Yes.
Here we go.
Ms. Podolsky, thank you so much for allowing me to examine and perform a few tests. Now, before I discuss my findings, is it okay if I go over a few quick questions with you to put those findings in context?
Oh, yes, that's perfectly fine, doctor.
Okay, so Mrs. Podolsky, can you please tell me from a dental perspective, what is your primary complaint?
I don't have any complaint. I just came for checkup.
Okay. Is it all right if I ask you a few more questions?
Yeah, sure. But is everything okay, doctor, about my teeth?
Yeah, I just wanted to go through these questions before I mention those findings. Have you had any complaints of any bleeding gums or wobbly teeth, or maybe a change in your bite, teeth drifting, anything like that?
Yes, I mean, I do have some teeth that are a bit loose at the back. Yes, I do feel like some teeth, where my bite is shifted, but it's not concerning. With occasional bleeding, yes, here and there, but yeah, nothing
All
major.
right. All right. Thank you for that. And when was the last time you visited a dentist, if I may ask?
Well, it wasn't long ago, maybe about 3 years ago.
Okay, that's great. So since you last visited your dentist, has there been any change or increase in your symptoms? As you said, the wobbly teeth and the bleeding gums, has it accelerated a lot since the last time you visited?
Oh, well, I don't think so. It's accelerated, but yeah, it's been gradually happening. Um, but yeah, doctor, I mean, should I worry about it?
Um, I'll just I'm so sorry. I'll just go through a few more questions before I discuss it. Um, from a how do you manage your oral hygiene on a day-to-day basis?
Oh, I brush my teeth 3 times in a day. I mean, I would even do 4 if I had the opportunity, but I'd look after my teeth really, really well.
Okay, and what about cleaning in between the teeth?
Well, I don't, unless something gets stuck, but no, I don't.
Okay, that's great. And if I may ask, when was the last time you visited a general practitioner?
Oh, and I
Have
haven't
you?
seen a GP. I don't even remember. It's been over 20, 25 years, I guess. I mean, it's been a long time.
Oh wow. I mean, is there any reason for that?
I haven't been, that isn't that great because I haven't been sick. I mean, I've been looking after myself really well. And even during COVID times, I did amazing. So yeah, I just didn't feel the need to go.
Oh, that's great. But I mean, even if you are feeling great, there might be certain things happening in the background in your body, which is why it's a great idea to go for your regular GP visits and do your blood tests. So are you
I mean,
taking any
I'm fine. I
medication?
don't have any symptoms. I'm doing well.
Okay, that's great. So you're not taking any medications or anything like that?
No, nothing at all. I'm 100% natural.
Okay. And if you are aware, is there anyone in your family who's had a history of gum disease such as you, like where there's wobbly teeth or bleeding gums or anything like that? If you're aware.
No, I don't know. No.
Okay. And how about diabetes? Any family history of diabetes?
No idea.
Okay, that's all right. And if I may ask, does anyone in your family have had any heart disease or unexplained fever?
I mean,
Or
fever is normal, isn't it?
sure, that's sure. All right.
So, Doctor, I'm
In
a
your
bit curious to learn more about it. I mean, you've been asking me too many questions. Is everything okay? I mean, what should I worry
um,
about anything?
I'm so sorry about that. No, I will. You don't have anything to worry about per se, but I will be letting you know what I've observed in your mouth. All right. Is it okay if I go over one quick question?
Yeah.
In your line of work, would you say that you're stressed? Is it stressful for you?
No, life is fairly good. I mean, no stress at all.
Okay. And do you smoke or drink alcohol?
No.
All right. All right. Thank you so much for answering my questions. I'm sorry if I took a lot of time with that. Now I'd like to discuss your findings if that's okay with you.
Well, I'm very keen.
All right, that's great. So in this X-ray, if you can notice on the upper right side, do you see that white line at the neck of the teeth,
Mm-hmm.
which has gone up considerably? Now,
Yeah.
this signifies that you've had extensive bone loss, and clinically also when I noticed there was a lot of your gums have sort of pulled away from your tooth. So
How did you know
essentially,
that?
um, as I mentioned, I did a few examinations. I did an
Well, the only thing I
intraoral.
can remember was you took this X-ray, doctor. So could you see my gums pulling away on this?
No, 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 no.
So
All right.
what's been going on? So I'm quite
So just,
shocked to see so many
all
teeth
right.
that I mean, I was brushing my teeth 3 times in a day and I thought I'm doing well.
I understand that. I understand that. No, so what has happened is from the X-ray, we can definitely conclude that there's been a lot of bone loss, which is basically the structure which holds the tooth, and that is what is explaining your complaint of wobbly teeth. Now,
Mhm.
this is a chronic, long-standing infection, which we call as generalized periodontitis. Are you aware of this, or do you want me to
No, I
explain more
don't. But
about
you're saying long-standing. I mean, I saw my dentist 3 years ago. I don't think so. This was mentioned to me. I mean, do you think it's been there for longer than that?
No, it could be that it could have been there, it could have been missed, or it could have progressed since then. Um, all right.
But why would I be having this, doctor? You know, why would my teeth be loose?
All right. I'd like to explain that for you. Since it's a gum disease, essentially, because of the gums moving away and the bone loss, that's created pockets, spaces between your tooth and gums, wherein bacteria has formed, right? And now that is the one which has potentiated and increased your gum disease. Now, although bacteria is one of the main reasons, however, other factors such as diabetes or stress, these can also be contributing factors. But in
Don't
essence,
have them,
right
and I
now,
don't have any of those.
all right, that's great, that's great. But as of now, what I can see, you have generalized periodontitis, generalized because the bone loss is not just in your upper right side, but it is spread all over your mouth, especially the upper right side, the lower left and right sides as well. And
Am I going to lose teeth?
so certain teeth have lost a significant amount of bone, and I am a bit concerned about that. So yes, I am a little concerned about that.
How
Now,
many
also,
teeth
I'd
am I
like to,
losing, doctor?
right, right. So the upper right side teeth have a little bit of questionable prognosis. Now, the reason for this is your disease, or the gum disease is generalized periodontitis, but it is also staged as stage 4, which is a very severe form of the disease where I can conclude this based on the excessive amount of bone loss. And also, I concluded that this was a grade C, which is a very rapid progression of your disease. So that could possibly explain why it wasn't there in your previous dentist
Well, why
visit.
is it? How did you know it's a grade C? And how did you know it's rapid? You said earlier that it's chronic.
Right. It is rapid. And the reason for that is I could conclude based on the amount of bone loss that you had and based on your age, I found that to be a very rapid progression, and hence I concluded to be grade C. So,
Okay, so what are we going to do about it?
all right. So now, as I mentioned, since this is a very severe form of the gum disease with a very rapid progression, now before I mention the treatment methodologies, I'd like to say the most important thing for you to do is to tackle this disease is to maintain good oral hygiene. As you mentioned, you are brushing 3 times daily, although twice is good enough, provided you brush 2 minutes each time. And also, you mentioned that you don't go for any interdental cleaning. So there are interdental flosses or pixters which you can use to clean in between. Now, secondly, I can do a superficial cleaning for you. However, that will just remove the top layer of debris, and it might slightly reduce your bacterial load. And now third is I'd like to refer you to a specialist, a periodontist, to go for deep cleaning, flap surgery, put in grafts and bone grafts.
All right, great.
Right.
So much. Wonderful. Time goes away so quickly, isn't it?
Yes, that wasn't how it was when I practiced.
Yes,
Yes.
well, that's how it goes in the exam, right? Conversation. No, it was amazing to really see that clinician side of you. The conversation we had, the questions were amazing. So, what do you think about it? What's the main idea?
I felt I contradicted myself a few times. I probably got carried away with a few questions. Um, and obviously, I would have liked to manage my time better and probably not repeat. I felt I was repeating certain things and I was losing out time on that. Probably could have been a little bit more attentive to what you are seeing as a patient. So, I mean, yeah, there's a lot of scope for improvement, but this is my first time. So I
First
hope
role play, no, it was good. It was amazing. So that's as you mentioned that. So the way the OSCE start, first thing, always make sure we look at the top line. Why are they attending? So this is always going to be. Now, what you might see on the website is always going to be different to what we're going to be doing in the classes. I try to give you guys a different version here, so that I can catch you by surprise. That's the part I love. And that's what I want to see. Did you read the scenario? So it says attending your clinic today for checkup. So whatever reason they're here, this is going to be your starting statement always. So this shows the examiner you've read, you know the situation. Also, you need to see if it's not given on the screen or if it's not on the table, then it's not done. So here, OPG is given. It doesn't say. Now, in some cases in the exam, of course, you will not find perio chart on the screen. It will be on the table. But in this case, they never give any perio chart because we've not done any periodontal examination yet. All we've done is taken this X-ray. Right? So that's why I just kind of paused. I was like, when did you do that? Right? So this is a very common thing that happens to many people. We assume, never assume. If it's not here, then it's not done. Okay? But that's where the assessment comes. If there is no perio chart, then how did we know it's a stage 4 and a grade C? What formulas did we apply to conclude that, right? And also, now recently in the exam, some people told me that the patient's age has been increased to 70, which is, again, normally it was all in the 55 years, but usually it's 55 and above. And this is where we tend to see a lot, a lot of medical conditions, problems. So what is this case built on? This case is built on diabetes. There is diabetes here. Now, is it given? Is this patient diagnosed? No. This patient has never been to a GP. So we are trying to make correlations here and looking at the patient's teeth, trying to understand what would have led to this condition. So when we talk about staging only tells us about the severity, how severe it is, and how complex our treatment is going to be. But grading is more about was it slow, moderate, or rapid? And if you look at it, normally the timeline is 5 years. This is where, that's why, for normal patients, we repeat OPG every 5 years. So whether this was there for 20 years, this gum disease, whether this was less than 5 years, how would I know? By asking questions. So the way we need to go about, this one was still an easier version. I'll come back to the other version, which is this, where you don't even see any bone loss. This is the most difficult version. If it ever comes in the exam, I'll explain that later. So also in terms of variation, you see, so who is this patient? So this is basically about a patient that hasn't seen GP for 20, 25 years. This is like a standard across all versions. This never changes. This is a fact, reality. Yes, some version also, along with not seeing a GP, this patient did not see a dentist as well for over 10 years because where this patient lived, there was no facility out there. But also there's another version where, like I saw a dentist 2 or 3 years ago because I was living in a regional area and I moved to the city now. So yeah, I mean, it's not too bad now. So family history can or cannot be positive. So it really differs. Now, should we go in this case? Now, also, remember, you have to look at the patient demographic. Diabetes is more common in certain races, in certain communities. So whether this patient had diabetes because they had a family history, this patient probably would have diabetes maybe because of, in general, we do see people with obesity, lifestyle, or whether this patient was coming from an Aboriginal community. All right. Now, there is a version in the exam. It's not given on the screen. It's not given anywhere that this patient is Aboriginal. It's not given. How would you know? And why is it important? So, and you find that a lot of these, First Nation people, you'll find them, because as we say that they are the owners of this land, you'll find them more in the regional area and remote. This is the yellow area is the remote. And then these are the greens ones are remote, and then outer regional, inner regional. So you'll find them more in these regional areas more so. And how would I know if this patient is coming from the area? So asking them why they didn't see their GP will help you answer that question. Okay, so I wasn't doing that version. I was just doing a version where my perception was the barrier. But in other versions where you have Aboriginal, they might say sometimes, they say, well, look, doctor, the place where I live, we don't have health facility out there. So then the question comes, where do you live? I want you to look at Australia map. I want you to read, there's some guidance notes by ADC as well, by ADA as well. The challenges that we have with people living in rural, remote communities. And what the government is doing right now is they're trying to bridge the gap. And it's always a good idea to have their own people trained, and then they can go back and educate their community. So we do tend to see diabetes, screening in these communities at the age of 18. They are twice more at risk of having diabetes. So that was the issue. This guy, he got this case and he failed. Many people failed this case. One, he did not talk much about diabetes. Two, he did not pick on Aboriginal. And then the one thing I did ask him, I said, was the patient making an eye contact with you? And he said no. I was like, okay, well, that was a sign. If examiners are not making an eye contact with you, that's a red flag. Okay, make sure it's not a coincidence. Eye contact is something they would expect us to make. It's a bare minimum that you should expect from the patients to do it. If they're not, could be Aboriginal. So going back here, how should we go? As you said, we say, all right, well, Mrs. Baldowski, well, given that you're mainly here today for some checkup, so this is why I just took this X-ray, and we could look at it together. And I also wanted to ask you a couple of questions to see if you have any concerns, anything that you need me to have a look specifically. And patient says, oh, well, not really. No, doctor, I'm fine. I don't have any concerns. Okay, well, that's wonderful. So, Mrs. Baldowski, would it be okay if I have some routine questions? Because that might help me explain what I'm looking at the X-ray. Patient says, all right. So, Mrs. Baldowski, since you don't have any concerns, are you experiencing any pain sensitivity in any of your teeth? So normally it's up to you whichever way you go. I like to always prioritize discomfort. Now, if I'm looking at this amount of bone loss, I would expect some recessions. And when there's recession, there would be sensitivity, because I haven't done any perio charting, can't see the gums on the X-ray, but that sensitivity can give me a hint that there is recession happening here. All right, so you have to think differently here. So that's why I'm asking, have you noticed any sensitivity to extreme temperatures in any of teeth? And patient says, oh, doctor, I have sensitivity to cold. And then I'll ask, right, okay, how long has it been going on? And do you know which teeth are they? Patient says, oh, well, it's been a while, I think, maybe 2-3 years. And yes, some of my teeth at the back. Okay. And also, apart from the sensitivity, have you noticed any bleeding gums? Pause. Never in this case, ask questions. If you ask 4 questions in a row, we call this as I think it was a name for that, a laundry basket question. I think there was some terminology that we use, where it means that when you go to a restaurant, when you ask somebody, what do you like to eat? Gin. So that's where people get confused. Pause, 2-second pause. Pause allows them to talk. So, any bleeding gums? Now, patient says, "Oh, well, yeah, doctor, I've got, bleeding gums occasionally." Okay, oh, okay. And do you mind if I ask you, like, how long has it been going on, and what brings about it? Now, this is so important. Bleeding gums will give you an onset. We need an onset. If the gums were not bleeding 5 years ago, and now they're bleeding within 5 years, this is what we're talking about, rapid onset here, because there is no period chart. So this will really depend on how you gather data. So the onset is important for bleeding gums. The trigger is important. And sometimes in this case, patient says, "But isn't bleeding gums normal?" So that's the perception that we need to question. I mean, if you were bleeding anywhere in your body, would you think that's normal? Then how is it okay inside your mouth? And usually in this case, bleeding was triggered when the patient was cleaning or brushing his teeth. Then I'll ask, okay, patient says, "Well, it's been a while, doctor, maybe, a few years, maybe 3-4 years." Okay, all right, that's thanks for sharing that. And what about your teeth? Have you noticed any of your teeth being loose, or your bite has shifted in any way? Mobility. Patient says, "Yes, I've noticed that as well. My bite has shifted a bit." Then again, very important, you want to know how long has it been, which is the onset, and which teeth are they. All right, especially in this version where you don't see any bone loss. This is the most difficult version. It's very important to know which teeth and how long ago. And that was positive. So bleeding, sensitivity, mobility. These 3 are very essential questions. You need to know the onset, you need to know the triggers, and which areas is it affecting. So now that you've got that information, don't continue with the history. Move away. In cluster 2, just spend 2 minutes in history, start explaining. Because if you continue with the history, this is when now the examiners will start interrupting you. "But what is it, doctor?" As I was doing. What's happening? Now, I am testing. What I was testing here was the approach. So this is where, okay, knowledge-wise, they know you guys are amazing. You have, a lot of information, knowledge. But what actually they are looking at is who we are. Do we have the interpersonal skills? This is what they're looking at, right? So, and interpersonal skills, they're looking at what are the traits of passing candidates. They're able to connect instantly, interested in the patient, explanations they reformulate, and they meet the patient halfway. All right. Basically, you're guided by the patient. But doctor-centered it's let me finish this up. Let me walk you through everything. Let me tell you what is best for you. That's something that again, sign of the cultures that we have. I mean, in my country, I can talk about it like most of us, we talk like that because our patients' education level is not the same level. So this is how we train. This is the problem that we need to fix. And then there's the other extreme is overly patient-centered, which is wherever the patient leads me, I have no agenda, no plan. I just go with the flow. Again, they don't like that attitude. So meeting halfway is important. So we go back here and we say, all right, now, Mrs. Buldowski, well, thanks for sharing that information with me. And I guess it might explain what I was looking in this x-ray earlier. If you can look at here with me, do you see these shadows around these areas? So this is where we're starting to see significant amount of bone loss in your bottom and top jaw, especially at the back teeth, which normally should have been around the neck of your tooth here all along. And if you see that more than 30% of your teeth have been affected, so we call this as generalized periodontitis, which means inflammation of the gums and the bone. And oftentimes this happens because of the bacteria that are irritating it. Now, in order to see how severe your gum condition is and how complex the treatment's gonna be, we stage it into 4, and we've given you the highest stage, which is 4, because if you see the amount of bone loss that we're looking at is way more than we anticipate for your age as well. And also it's covering more than, I mean, that's again grade C, which is the progression. Bone loss divided by your age is way more, and also it's covering more than 2/3 of the tooth. And I'm worried about these 6 teeth that you're about to lose, more than 6 teeth. So based on what criteria? So staging we did on the amount of bone loss. Bone loss was more than 60 to 80%, right? So we could see that. So in the difference between stage 3 and stage 4 is stage 4 is more a complicated version of stage 3. The bone loss was 80 to 90%. Patient was about to lose 5 or more teeth. So we use these 2 criteria. Without clinical attachment loss, we use these 2 to say it's a stage 4. And we use the criteria about grade C is that the amount of bone loss was way more than your age. All right, so that's basically we used percentage of bone loss versus age. Now, then you go back and say, now, Mrs. Bolosky, the question here is, why would you be experiencing this amount of bone loss at your age? It's very uncommon for us to see this. So that takes me to a few more questions, if that's okay, so that we have more understanding. Now, ask me questions. Now, the questions that you would ask me is about my general health and also about my family and about my oral health. All right, whichever way you go, doesn't matter. So we say, all right, now, Mrs. Dmolowski, so that's why I'm a bit concerned about, why would you be having this amount of bone loss? So would you mind if I ask you a few more questions to have more understanding? Patient says, yes. So how is your general health? Patient says, oh, I'm fit and healthy. That's wonderful. So have you had any blood tests done, any health check done lately? Patient says, no, I haven't done it in about 20, 25 years. Really? Well, that's been a while. What about your dental checks? Have you been regular with your dentist? Patient says, well, look, yeah, I mean, I saw my dentist 3 years ago. Okay, but have you been regular before that? No. What's the reason behind that, Mrs. Bolosky? You haven't been regular with your doctor or your dentist. Patient says, well, it's because I feel great. I look after myself really well. I haven't been sick and look after my teeth really well. Then I'll say, all right, that sounds amazing. So that also makes me quite curious to learn more about how have you been looking after your teeth. So patient says, I'm brushing 3 times in a day. And then the next question is, all right, and Ms. Bolosi, do you use anything to clean in between your teeth? Any dental brushes or floss or anything else? Patient says, no, I don't use anything unless something got stuck. Now, I did it on purpose. So remember, every answer that the examiners are going to give you is calculated. Every word is measured. Everything is given in measures, and you have to pick it up. So I said, I don't use it unless something gets, and I paused, and I was waiting for the next question. Oh, so when it gets stuck, what do? I use a toothpick. So this is how the way the exam works. So they give you some information and then they're going to pause. Then they give you some information and they're going to pause, hold back, because we're testing your data gathering skills. We're testing how you're going to take the conversation forward. This is how they speak here. So then I was using a toothpick. And then from there onwards, I'll say, well, Mrs. Boldosi, well, thanks for sharing that with me. And I guess I might have some answers for you because you mentioned that you're brushing your teeth twice or thrice in a day, which is amazing. Normal recommendation is twice a day, but I don't know if you're aware, the tooth has got 5 different surfaces. So brushing mainly cleans the 3 different surfaces, but the areas, as you can see, in between the teeth, you cannot clean it with a toothbrush alone. So we might have to use some interdental brushes or some floss. And you mentioned about using a toothpick. Now, toothpick might injure your gums, may not reach all the areas, and you haven't seen your dentist for 3 years. So there could be areas where these bacteria started to build up and irritate your gums and your brain. And if you can see here, this is where we call it the furcation or the branches of the teeth. These are areas sometimes even more harder to clean when your gums, they go down. Or these, I need to check your fillings as well to see if it's sticking out, allowing more for these to grow. But having said that, it's even more important for us to see why your body wasn't able to fight back. So you mentioned about you haven't seen your doctor for over 20 years. Now, what I'm concerned about is could there be any underlying medical conditions, and especially at your age, something that we would like to rule out is diabetes or any nutritional deficiencies. Now, Mr. Bolowski, have you noticed any unusual weight, thirst, or do you feel hungry a lot more often? Patient says, well, yeah, I guess that's fairly normal. You say, okay, because now the reason why I'm suspecting that is with diabetes, your immune system would suddenly go down. It wouldn't be able to fight back. And when there's a lot of more sugar in the blood, then these bacteria, they thrive in that environment. The mouth feels more drier than usual. Saliva cannot flush it away. So sometimes, it helps us kind of look into your general health. So do you have your GP or anybody that we could request to organize a blood test for you? Ask this patient about it. Don't say go back to your GP. This is, if somebody says that, it tells the examiner that you're not listening to the patient. Who do I go to? I don't even have a GP. So which GP should I go to? So this is a common mistake I see. They say, go back to your GP. And I'm like, okay. Explain it. And then, and how do we go now managing this patient? So we say, all right, now, Mrs. Boldowski, in terms of managing your condition, there's a few ways we can go together, but I just wanted to know, what were you hoping that I would do for you today? Expectation. Please make sure whenever in cluster 2, you come to the management, you do not decide the treatment order. You should have the treatment in your mind. Patient gets to decide which option should I deliver first. Your job is to give an objective, ask what is patient's expectations, and based on that, take the conversation forward. This is what we call as person-centered care. So if patient says, so Mrs. Boldowski, what were you hoping? I say, well, I don't know. Look, I'm just worried about losing teeth. So doctor, what do you suggest? We say, well, Mrs. Boldowski, well, see, your concerns are valid because, like I mentioned, some of those teeth in the top jaw may be a bit more difficult for us to say, but there are others that we can still do. So I guess a good starting point for us would be to reduce the amount of bacterial load inside your mouth. And what I can offer you is a cleaning, a superficial cleaning. I can do it all around your mouth. And also for deeper cleaning, I can do it. But we have to book you in a few appointments and we need to numb you up as well. Now, the good thing about that is the bleeding will settle. And also for sensitivity, we can apply some varnishes. I'll check your fillings to see if they require any adjustment. And if your teeth are, I wouldn't be removing any of those teeth. I'll refer you to a GP. Let's organize a blood test. And in meanwhile, put the wires and stabilize them. Unless we know for sure you don't have diabetes, then we can remove it. But the downside is I wouldn't be able to clean below the gum line. And especially around some of your teeth at the back, especially where those branches, the furcations are. And any bacteria left there will continue to cause more bone loss. So for some of your teeth, I would like to refer you to a specialist called a periodontist. Now, would you like me to explain more about what they might do? Yes. Now explain it to them because this is about specialist management. So remember, when we are referring to specialists, we don't do it for all the teeth. We do it for certain teeth that are beyond your scope, but the remaining you should be able to do it according to new TG. So now they want to know, what would a specialist do? So what a specialist would do differently is we explain to the patient now what a specialist may do is they might just basically raise your gums, clean under direct vision, and also where you've lost bone, they might just add in some bone. Your gums are shrinking, gum grafting. Of course, it's a surgical procedure. There will be time, cost involved. And with every surgical procedure comes with its own complications, and it can sometimes fail if we did not comply. So it's important that you and I, we work together as a team. So this is where we're going to push our health promo. And health promotion is completely in line with the patient's general health. So diabetes is extremely important. This patient is diabetic. Any question? Any question for me?
Dr. Nazia,
Mm-hmm.
for the back teeth, posterior teeth, almost all the teeth are having severe bone loss. So we are not cleaning them at all.
Look, if let's say if you want to clean, I'm sure they would have those natural plaque or calculus splint, right?
Mm-hmm.
So our objective for today is reduce the bacterial count. So don't promise the patient I'll do it all today. Just say that if you want, I can do a bit of superficial cleaning or more so around your front teeth. And for the back teeth, we can poke you in cordon wise, and these ones left and right may need to come out. So, and it's also a good idea to do scaling before you do extraction. Remember, there's a case called post-surgical infection.
Yes, yes.
And you know what happens in post-surgical infection? When you don't do a scaling, look at this. Gross, this is what I'm talking about. However, it is strongly recommended that a gross debridement be performed before tooth extraction. It helps limit the possibility of accidentally dislodging a piece of calculus into the extraction socket. Right?
Yeah.
So that's what we're talking about. So specialist part, what are the keywords we're going to use? So remember, when you're doing these cases, you need to know the keywords and just shorten usage. So the keyword for specialists is number one, that they will basically go with a surgical approach where they're going to be cleaning your gums. So how they do it is number one, flaps, right? So they raise the gums or they will expurgate. This is what we do. Second part, as you can see, what are the phases of, and in the exam, maybe rather than talking about option one or option two, how about we talk about phase one, phase two, which is how it is aligned in the books. So I think this is going to be more professional. So you say, all right, now Mrs. Boldowski, now the way we're going to be looking after your oral health would be in different phases. So phase one, where you and I are coming together, is where we need to reduce the bacterial load, we need to control the disease and provide you the initial treatment. So this is the objective. How do we do it? So my part would be to provide you professional cleaning, remove those hard deposits from your teeth, and also, if I were to clean below the gum line, we'll do it in a few appointments, we'll you up as well. And this will settle the bleeding for sensitivity, tell them what you're going to do. And also, you need to basically do adjustments of the fillings. Don't leave anything plaque retentive. If teeth are mobile, splint it up. So that's your phase one. And then after that, we'll get the blood reports, and then we are also going to monitor how it's happening, because when you refer a patient, it's not that they're going to get the appointment tomorrow. The way it works here, sometimes it might take, if I'm talking about public system, it takes sometimes 10 to 12 months as well to see a specialist when you put that referral in. Unless they go to a private, and private practice owners, of course, there's many, they're very expensive. So we say to the patient that I'll make a referral and then to the specialist. Now, what a specialist do is here, they're going to raise it, they're going to clean it for you. And the areas where you've lost bone, they want to know what would they do. So the areas you've lost bone, they might do different procedures like adding some material that would allow the bone to grow. We call it guided tissue regeneration, or add some bone in there. And then where your gums are shrinking away, they might do some gum grafting as well. So they were really keen to know about GTR, guided tissue regeneration, or the other technique that we use, add some bone. And then what is the downside? Downside is cost. It is expensive. Time, regular, normal surgical complications like pain, swelling, and more importantly, it can still fail. It's like the filling that we did in the previous one. Putting a filling is not for life. It can fail. This can also fail if you do not comply. So we need to work together, which is phase 3, maintenance. You come back in again. They finish the active treatment with the specialist. They need to come back. Your job is to do the follow-ups. Your job is to maintain 3 to 4 monthly intervals and keep checking them if they're keeping up with that. And this is where we delegate the work. What is your role? What is the patient's role? All right. Now, why diabetes is such a big deal? Now, undiagnosed, this is from TG. So TG says that consider the possibility of undiagnosed diabetes if there is a sudden onset or progression. This was this case. There was sudden onset or progression. And in Australia, anybody that is over the age of 40, every 3 years, their GP should be doing a diabetes check. But for the Aboriginal community, they do it early on. They do it at 18. And what happens? What if I don't have diabetes? And what could lead to diabetes? What if I don't have any family history of diabetes at all? Could I still be having diabetes? Yes, this is from BDJ. So BDJ says that people who do not even have diabetes, we know that periodontitis can trigger, because periodontitis will increase insulin resistance. Oftentimes, untreated periodontitis leads to circulating bacterial and also those inflammatory markers. Then it causes inflammation in the body, and that increases insulin resistance. Now, if somebody also is living a lifestyle that is not healthy, it triggers diabetes, despite having no family history at all. Or it is possible that patient had diabetes, wasn't aware about it, and then now diabetes impacted the gums by reducing the immunity and all those problems. So we don't know whether gum disease triggered diabetes or diabetes triggered the gum disease, but these two are 100% connected. That's what they're interested in. Any question?
Dr. Nazia, just one quick question. It's regarding how would you get a hint from the case in order for you to ask if they belong to a particular category like Aboriginal or Torres Islander? Like, is it the name or is it the body language that the examiner would give? Like, as you mentioned, there would be no eye contact. So how would we understand from the case, like, in order for us to ask them that question?
It's tricky, isn't it?
Yes.
Yeah. So going back to that situation, how would we know? I think I had a slide here if I can find it out. So yes, this is from Queensland. So this is, again, I want you guys to find any article, research, First Nation people, what are the challenges that they have? What are we talking about? Bridging the gap. So with these community, they have these strong ties. They live together. They love spending time together. And of course, is when you spend more time, of course, comes with many different challenges as well. And we need to understand that they have, number one, there was a new guideline as well shared by ADC. There was something they shared as well, was very amazing. They said when you're communicating with them, make sure that avoid using different difficult words. Now, why wouldn't they make any eye contact? If somebody's not making an eye contact, either they have autism, they're neurodiverse, or it's part of this. Now, according to their culture and many different cultures, including my own culture, making an eye contact with somebody that is older to you, elder, is part of respect. You know, when you make an eye contact, it's like disrespecting that. So that's like old traditions, you know, happening. So avoidance of eye contact is customarily a gesture of respect. Do you see that?
Mhm.
That's why this patient was not making any eye contact with us. Another way to find out was saying yes. Now, the other way is this examiner with this particular candidate, I said, okay, was the patient making eye contact? He said, no. I said, was he saying a lot of yes? He said, yes. And I said, that's it. Because now the problem with that is, it's like your own parents. Sometimes when you bring them to Australia, you see that when they don't understand the language, what they do, they say yes, yes, just to get you off their back, right? If a person is repeatedly saying yes, number one, they don't understand what you're saying, and they just really want you to get away. All right. So
Yeah.
that's what it says. People may say yes to questions to end the conversation. It's not that they're agreeing, it's the opposite of what we're assuming. So they're saying yes so that they can get on with their own life, deal with their own priorities. You are not a priority. That means they don't want to come back again. Okay.
Okay.
So that's where we have to make sure. The third way to know is asking them why they haven't seen their doctor or GP or dentist. And then they will tell you that the place where I live or I come from far. So next logical step is, where do you come from? Which place it is, right? So if they're talking about, you know, top part of Queensland, I mean, Queensland is vast, which is where I am. Then those are the places that you need to, sometimes they say, oh, I come from North Queensland. I come from, you know, Northern Territory. Now, in these places, and this patient said that, oh, I work as a oral, I think the government is running some programs these days. So what they're doing is they're training these Indigenous Australians and then training their own people to become these oral health practitioners, like, you know, so that they can go and educate them. So patient said, I've just taken this job as an oral health practitioner. There's a conference as a healthcare worker, and I'm here for a conference, and I'm going to go back. So these are some signs that will tell you.
Okay.
But how are we going to provide care to this patient if they're coming from this part of the world? What do you think? So if, let's say, patient says, I'm come from here or here. So what should we do?
Mobile dental one.
Mobile dental one, yes, that's one thing. Do they always go there?
Telehealth or Royal Flying Doctor Services, Dr. Nazia?
Yes, so Royal Flying Doctors services are very, very good. So we have to kind of now know, in this case, you have to talk about teledentistry as well. So what happens is that when today I will ask them, so how long are you planning to stay here? Patient says, maybe I'm here for another 2-3 days. Okay. Well, in that case, you know, would it be okay if we have a very good GP next door? We can organize some blood tests before you leave so that we make sure you don't have diabetes, you know, and then I would be making that referral. Now, what a specialist would do is they will do the first consultation via telehealth. They will plan out the treatment with you, discuss all the timeline procedures with you, and plan your treatment. And then you will need to travel. They will organize your trip. You need to travel back to here. And, you know, the government, they provide them vouchers. So they can use these vouchers. So when can they utilize? So can you provide it? No, you can't. So these vouchers are, I have got these vouchers. I think there was, these vouchers are given, where is it? These are provided by the government, and then they need to come. And as part of these vouchers, their travel expenses, accommodation is all covered by the government. They can get the treatment in one go and they can go. This is a question they're asking. Where I live, would a specialist come here and treat me? No, you have to travel to the specialist. But how it's done, the first one is going to be via telehealth, and then it will be planned, and then they need to come, and then that's where the procedure is done for them in one go. What about GP? What should I do? Where do I get my blood test? So I'll ask them, sir, how long would it take for you to travel to the nearest health facility? If it's taking them 5 hours, we can say, well, look, we can organize with the Royal Flying Doctors. They should be able to, visit you. And for regular dental checks as well, there is mobile dental services. We could look into, which one is coming in your area, and perhaps we can use those. So mobile dental services are very important in this case. Telehealth, mobile dental services. This is about guiding them on the I'm just trying to find, sorry, I'm just switching. Yeah. So these Royal Doctor Services, these are the ones. They have these dental areas as well. This route they go to. And then they have a timeline. So, and these are full equipments that they go. Okay. So if you get this version, make sure you are guiding them on the aftercare support, how the government is going to support them. Okay, so that's one thing. What if you get this version? This is the hardest version, where it says stage 4 grade C, and yet there's bone losses like this. So, and they're asking, doctor, how did you conclude this is stage 4 grade C? So what do you think?
It's an angular bone loss which we cannot see in the OPG, so we will be doing the pedipicals.
But yeah, that's fine. But then how would you know it's a stage 4 grade C?
Drifting history.
So yes, that's a very important, because we're relying on the data. We're relying on the history. So there's 3 extremely important history questions: bleeding, mobility or drifting of teeth, and third one is sensitivity. These are 3 extremely important questions that you need to ask, and ask them about the onset, the location, and the trigger. Okay, that's very important, because that will guide you. So when you ask them about, so have you noticed any mobility in any of your teeth, or your bite changing, shifting? Patient says, yes, I've noticed it. And I ask them, how long has it been, and which exact, can you point out the areas, which teeth? So patients wouldn't give you exact location, but they say, oh, some of my back teeth in the lower jaw, and it's been maybe 2-3 years. That's what I know, because in the lower jaw, this is what I'm looking at is a buccal bone. What I can't see is the lingual bone. So maybe it is possible that the lingual bone is lost and I can't see it. So I'm going to use that information, teeth drifting, as when I'm explaining stage 4. Now, what about grade C? How can I say it's rapid? Because in the previous one, we said, oh, it's rapid because the amount of bone loss I can see divided by your age is high. But in this case, I don't see much bone loss. All I can see is 50% divided by the patient's age. I don't think so. It's going to go into C. It can, but not so much. So the other way to know is via bleeding gums. So bleeding gums just simply means on-off switch. If my gums were never bleeding, and this patient was never a smoker, so no smoker, their gums ideally should be bleeding if they had a gum disease going on for many years. But my gums never bled, but it's only been 2-3 years that it started to bleed. So that means in 2-3 years, the onset of bleeding is giving me the onset of this gum disease. And if it's 3 years ago and now I'm seeing this amount of bone loss, it's rapid. Okay, so this is very important, because they will stop you here. Tell me, why is it a stage 4? Why is it a grade C? Clear, everyone, about this?
Dr. Nazia,
Yes.
so do they always give this diagnosis so that they want us to explain this stage 4 grade C, or they want us to diagnose?
No, diagnosis is always given in this case, always.
Always, okay. Okay, and can you tell me a little bit more how to differentiate stage 3 and 4?
So stage 3 and 4 are very similar. It's just in stage 4, we're talking about a little bit more complications, and complication means there is now more drifting of teeth, bite collapse. Do you see? So if you look at 3 and 4, you see bone loss more or less similar. If you do periodontal examination, 6 or more, vertical bone loss, truncation involved in 2 or 3. But what do you see now? Ridge defect. In 4, now, especially in the lingual side in the lower jaw, you'll see more bone loss, severe. Now, you're starting to see more mobility in stage 4 because that bone, lingual bone is gone. So, and also now the bite has started to shift. You get it?
Mm-hmm.
But you wouldn't see that in 3. So we're talking about 1 surface bony loss, 2 surface, 3 surface, right?
Yeah.
Bone loss. So in this one, in 4, you'll see more bone loss. Right?
Another question, like for the specialist treatment, what the specialist will do, because in the first appointment they need to take the gum charting. They have got different ways of gum charting. So how will they plan the treatment without gum charting?
Your job is to do it today.
But I think,
You're making a referral, right?
yeah, we are making it the referral, but the gum charting we do and they do, that is a lot more different.
So
Once I
I'm going
have
to take,
worked, yeah.
go on.
Once I have worked in perio specialist, so they have got different charting.
Yes, no, I agree. Now, like they say that you will be questioned and rewarded on your actions and nobody else, right? So when I'm referring any patient to any specialist, I need to see what is the inclusion, exclusion criteria and prerequisite. So inclusion criteria, yes, this patient does fit. Exclusion, that's why I need to monitor if they're maintaining their plaque score. Prerequisite. So when I'm filling this form, I need to make sure that I've done my general dental care, a detailed periodontal charting, a current OPG sent along with the form. Right?
Yeah, but in the very first appointment, they will not treat the patient. They will do just examination part.
No, I agree with that. That's what they will do. But this patient, remember, I'm talking about the version where patient is living in a remote community.
Yeah, in the remote community, when the patient will come to the very first time of after attending the dental health, what will they do? Will they proceed straight away with the corrective surgeries?
Now, the way they would do is now you've done your periodontal examination, you've taken an OPG, you will refer it to a specialist. So let's say I'm talking about the remote community. Now, this patient lives in a far end community.
Uh-huh.
So this patient now will be on a priority basis, especially if they have diabetes. Now, the first appointment, now the specialist could be here. They can't travel here. Patient cannot travel here. We're talking about expenses here, right?
Uh-huh.
So what happens is that the first appointment, they do a telehealth. Now, in the telehealth is where we collect basic information. The specialist needs to know some basic information as well, right? And the specialist will discuss with them about what they should expect in their trip, how, if they were to going to treat, how is it going to be planned, right? And then we'd call it as a basic, like kind of data collection or planning session. Then for these patients, then their travel is organized, and then they come for the appointment. They travel to the city, and when they come, then they're given vouchers so they can claim. There's cost. Stay. I don't know. They might pay them for a week. There's quite a few hospitals here in Brisbane as well where people come from regional area. They stay. There are accommodations right next to the hospitals where they're given food. They might stay for 1 week, 2 week, 1 month, depends on what they need. Their needs are. And then during that time, the specialists, they're working very closely, provide them treatment, what they need. And once they're done, because they will prioritize them since they need to go back, and then they go back. You get it?
Yeah. Like what data will they gather in the telehealth appointment?
See, a specialist, even when I was going through my own cancer journey, your specialist will not come and meet you at the theater. They will like to meet you beforehand, wouldn't they? Right? To check, and that's where it comes, and that's where the data is. I'm just going to go back to that form. Where is that article? And remember that when you guys are working in any places, never generalize the experience there to overall, because that's just one practice. That is one clinic. We're talking about the way the Australian system works and how they do it here. So, and this is a very good document. This is from a referral to the Royal Dental Hospital. So this is, I think, uploaded on the portal. I would encourage you guys to please read this. So let me show you. So whenever you are making a referral, there's 3 categories of referral. So when you're referring, 1, you're referring as a specialist consultation and examination only. 2, you want a specific treatment done in that area. Or 3, you want a comprehensive care where the treatment needs are beyond the attending practitioner's capabilities. And then you make that referral. And then once those referrals are accepted, then they say that the specialist referral inquiries to either pediatric or, again, they said based on the eligibility, I think, yeah. Service for clients from rural remote areas. Victorian Patient Transport Assistance Scheme. Clients needing access to specialist services who live more than 100 kilometers from the hospital are eligible to claim a subsidy from the Department of Health for travel and accommodation. Claim forms must be signed by the referring practitioners and the treating specialist before client can lodge a claim, and then they are lodged, right? So that's where basically we're talking about how should that be done, how the treatment should be planned. That's where the specialist would come. So our job is just to make that referral and let the specialist take it from there. The question they're asking, will the specialist come and see me? And I think it's given in teledentistry here. So I'm going to go back to, there's a very good slide that the specialist is not available. Where is it?
I think they are asking this question as well, like what the specialist will do by telehealth, and that too in the very first appointment. They're not gonna do anything. So what
No,
will
they're not going to do anything. That's right.
so what will they do then?
So what do you think about it, Sunita? So what do you think should be a good timeline?
I feel telehealth for at least a specialist, and that too very first, is not a good idea because they can't do anything. Even being a specialist, they will not motivate for just for brushing. They will have a telehealth appointment. So I think telehealth for a specialist is not a good option here.
Is this based on data or is it based on opinion?
Uh, I think it's a critical thinking that what will the specialist will do, because
Okay.
it's very hard to get the specialist appointment, and that too, what is the reason we will give to the examiner, because they asked this question for my friend. Okay, what will they do?
Yeah. So I'm going to go back to here. And I'm saying this because tele-dentistry or telehealth is done quite commonly in Australia, right? Where a travel, and I'm saying that again, coming from a health perspective from the system, none of the specialists in any field will just walk in and treat a patient like that, all right? Especially with somebody that has complex needs. And this patient, we're talking about a diabetic patient potentially. So they say that teledentistry must only be provided by dental practitioners as well. Then they say they must only be provided cases where direct face-to-face treatment or specialist advice cannot be provided, right? So now it cannot be provided. We are sending this patient. Would you be using it for all patients? No. We wouldn't use specialist telehealth for all cases. It's this patient that is diabetic, complex needs, cannot travel back. I am organizing a blood test today. Patient is leaving in 3 days. Now the reports will come. Probably this patient might be diabetic, right? Now all of that will be packed and sent to the specialist. Now for a specialist to look at all the blood reports, right? Possibly it's uncontrolled diabetic. Then that's where the conversation comes. So how are they going to be planning this treatment? Now, in that situation, can you treat this patient? No, I can't. Because not only it's a stage 4 grade C, and I'm going to go back to this article here, there are 3 categories of referral. If this patient was living in a city, I would refer them for certain teeth. You can see. here, specific treatment, because patient can come to me frequently. I can book it in a few appointments, and maybe for a few teeth I might refer, others I can manage according to new TG. But then somebody that lives in a report area where now they have uncontrolled diabetes on top of that, they have, stage 4 grade C. Now, all of that complexity means this patient needs a comprehensive care. So I'm handing it to the specialist. Do you get what I mean?
But Dr. Nazia, again, it will be elective procedure, and specialists will also don't do any elective procedure having diabetes,
No,
isn't
they
it?
do that. They do that. They do it with under the cover of antibiotic. It's your TG. Did you forget about that?
Okay.
In TG, there's a section. You don't confuse yourself with this with a specialist. Our domain is different. Specialist domain is different. And if you go to TG perio section, there are 3 categories where antibiotics are given to a patient. If you're not in perio, we don't give to a patient, but 1, where it's aggressive periodontitis cases. 2, where patient is not responding. Look at this. Antibiotic therapy is rarely required for periodontitis. Only consider therapy under the care of periodontist if periodontitis is rapidly progressing, has not responded, affects patient with immunocompromise, including patients with suboptimally managed diabetes. Specialists will do regardless of how the diabetes is. They will treat this patient, because if the diabetes is not treated, gum disease will not get better. If gum disease is not treated, diabetes will not get better. You get what I mean?
Yeah, I got your point that they have to do the treatment. But then again,
Don't
question is,
complicate it, Sunita.
what
See
they will
again,
do?
don't confuse yourself. Overthinking will kill you on the exam.
Like what they
Focus
will,
on
what specialist will do in the first appointment? My question is
planning. Why are we losing? So again, I'm just go back to again, Sunita, don't complicate. Go back to the phases of treatment. I think Perio has got some amazing articles on different phases of treatment.
Mhm.
And just remember that it's always planning before procedures, whether you do it or where a specialist do it. Nobody would ever stick their hands into somebody's mouth or without getting to know them, without having their consent. Consent is always the first step. Right? So that's where we do the consent part. Okay, but we'll come back to that question later on. I'm just mindful about the time. All right, so moving forward to the next case, and if you guys have question related to this, we can come back after one because some people have to leave. We have the Torres Islander, another case, which is important. So I'm going to open that up if you're ready.
Yeah.
All right. If you're ready, that's a cluster 3. And here we go.
Okay.
You're ready? Then here we go.
Well, Miss Terry, thank you so much for being very patient while I examined you, and I also managed to take an X-ray. And as I already told you, you have a condition which is called as acute apical periodontitis. That is the inflammation of the bones and the roots in that area. So, Miss Terry, before we look into the options that we have, is there any other concerns except the OAC that you're worried about and the HIV and hepatitis transmission? Yeah.
Well, I don't know what OAC is, but the thing is, doctor, I'm concerned. Because I've been experiencing pain on this tooth, and so I was wondering if you can remove this tooth for me, please, just so that I'm out of pain. But at the same time, my sister had her tooth removed, and then she did mention to me she had some hole in there that caused a lot of problems. So that's what I'm worried about.
All right, all right. No, yeah, I understand where your fear is coming from. Your fear is valid, Miss Terry. I will be talking about that, but before that, will it be okay if I ask you a couple of questions so that I can have a clear idea of what's happening to you?
All right, sounds good.
Terry, you said that you've been having pain from one of your top teeth. So, did you take anything to help you relieve of that pain?
Well, see, the doctor, I've been taking paracetamol and ibuprofen, so it does kind of help me a bit, but look again, it is what it is. So would you be able to remove this tooth for me, doctor?
Yes, Terry, I would be able to help you with that. Uh, yeah, Terry. Because you're very particular about removing the tooth. Is there any concern that I should be knowing of? Because is there any reason why you don't want to save the tooth?
Um, it's just something that, everybody did, my sister as well, my mom, when they had pain, they always removed the tooth. So, that's the thing. See, doctor, I'm a student nurse and, I've got a very busy schedule ahead as well.
All right.
So that's why I was wondering if you can do it.
All right, Ms. Terry. I'm going to help you with that. I'm going to help you with your concerns regarding that as well. But just wanted to ask you if any of your family members have any heart disease.
No, nothing at all. Everything's good.
Is there any medical history of yours that I should be?
No, nothing at all.
All right. Thank you so much. Have you had any past dental experiences?
No, this is my first experience. This is why I'm so worried about, doctor, that communication, that hole that my sister had. Do you think I could be at risk? Is that something that might happen to me as well?
Yes, Terry, I'm not going to tell you that there are no chances that it may not be happening to you. There are chances because, moving to options that we have in the X-ray that we see, if you can appreciate the thin white line and the roots that are into the beyond the white line, can you appreciate that, Terry?
Yep.
Yeah, that's a hollow space that we call it as a sinus. It helps us resonate a voice. All right. So, but this X-ray is just two dimensional. So, what I would like to do is like even before we talk about options that we have, with your permission, I would like to repeat an X-ray in from a different angulation and make
Okay.
sure if that root is still lying inside the sinus. And in your case, the bone that is separating or the sinus lining seems to be very thin. So what I would suggest is, yes, there are chances that that your fears are your fears are valid. All right. So you said that you had no idea about OAC. So just in a short note, I would like to tell you that it's nothing but when when I try removing the root, and if the root happens to be inside the sinus, there are chances that there can be a space or a passage that's created between the mouth and the hollow space. All right? Are you with
Mhm.
me so far?
Yeah.
So that's called as a oroantral communication that you were worried about, right?
So do
But
you
we're
reckon then the risk is very high in my case? Like, how would you know if there is a communication, if it had
yes.
developed?
That's a very good question, Terry. So that's why I said I would be repeating the X-ray. But with your fears, if we end up not doing anything at all, it's going to cause you infection or more pain. So the next option that we had was RCT, that root canal, that you were very not much inclined to it. So the only option we have is to remove the tooth. So this can be done by me or by a specialist. That would depend upon the X-ray that I'm going to take now. Yeah,
Okay.
Terry. Any
Okay. All
questions
right.
so far?
No, I'm good. So what would you do, doctor? I mean, if communication does develop, how would you know and how would
Yeah.
you manage?
Yeah. So when I remove the tooth, I would be using a different technique, which is called as a close technique, rather than the specialist. So when I remove the tooth, if I find there is some bone sticking to the tooth or the root, it means that I would have created a communication. And the other methods are, I would also, with a good illumination, I would see if there is a hole which I can appreciate. And there would also be air bubbles coming out of those, of the space. Yeah.
Okay. So how would
Uh,
you manage?
yeah, that's why I want to repeat another X-ray. If an another X-ray says depicts that the root is still very much inside the sinus, it would be best for me to refer you to a specialist, because what a specialist would do in a different ways, he would take the flap, open the flap and
What's that
section the tooth.
flap, doctor?
The gums away. I'm
Okay.
sorry.
Mhm.
He would open the gums and section the tooth and take it out atraumatically. And if you ask me, the chances are same. He can also create the same communication, but he would manage it right then and there. Yeah.
Okay, so it seems like it's going to be a surgical procedure. Now, doctor, you and I are working in health sector, and I'm just a student and just starting my career. There's
Yes.
quite a few, clinics nearby. I read about the breaches and infection. There was a case in Sydney where 5,000 patients are now going through HIV testing as well. Now, I'm worried about hepatitis C and HIV. How can you make sure that I'm safe?
Yes, Terry. I think being a nurse, I just have to probably I can take. I know you're very well informed how our system works. I can take you around the clinic, how our clinic works, and just to keep you well informed and fear free. All our staffs and everyone in the clinic are updated about the guidelines. We follow it from the Dental Board of Australia, and
But
we
how would
have.
I know that I'm safe?
That's because we follow protocols for every patient, like standard procedures
Mm-hmm.
and standard protocols and transmission-based protocols.
Mm-hmm.
And like to the point where we use single-use instruments, we dispose it. We have protocols for sharp instruments, and if there is a prick, we follow protocols to track back. And I'm going to also give you some brochures about the protocols that we follow in the clinic, Terry.
Mm-hmm. All right,
And
sounds good.
and the instruments we chemically disinfected. We batch control, and we track back if there is any breach in it. Yeah, Terry.
Okay, so that means, okay, that's well looked after. Okay, so what are we doing today?
Terry, today I would like to take another X-ray, as I told you, and the treatment would depend upon it. But I can also do something because the pain you have.
Yes.
because you are in a lot of pain, I can help you.
You're just shocked, froze.
I chose because I wanted to do this case because there was two, I think there was two variation of the case where it was apical periodontitis and pulpitis. I tried reading about it. I was very confused about the prophylactic and the therapeutic guidelines. I mean, the antibiotics protocol. So I think I froze there.
Yes, okay. Look again. It's first role play. Main thing is just getting you guys to speak. Beautiful. Like even though I could sense that you were a bit confused in the beginning, very anxious, but then you started to get yourself back on the track. So, um, now a couple of strategies I can give, but let's go through it. Like, what's your understanding about this case? What's the main idea? Every case has got one focus. What's the focus here?
I think yeah, there are a lot of points that I missed. She told me that she was a student and she was coming from a faraway place,
Mm-hmm. Yes.
and she had her own belief system that I had to talk about, which I didn't.
Mm-hmm. Yes. So that's important to know. So that's where basically, what are we dealing with? So we're dealing with this young individual. So it's always a good idea to, and I was supposed to be doing for the other cases as well. So let's put some faces to these cases. It just helps you kind of relate some emotions. You can kind of see it's a real case. It's not just a tourist. And we're talking about a young individual coming from a faraway community. Like I said, we're talking about Indigenous people in Australia. Sometimes they say I'm coming from a Warren Island. Sometimes they say I'm coming from the top part of the Queensland, or I'm coming from a Torres Strait Island. So these are the small islands that you might find it on top of Australia, or you might find them in the top part of the Queensland. And the issue that why this case is built on, so this case is built on the years of discrimination that these community they have experienced over the years, and I think Australia is just trying to go back and undo the damage that they've done to these communities, the trust that they've lost over passage of time. And what happened was, what maybe now she's young, she's 23. So I guess we all can relate. Your parents, your grandparents might tell you about the stories about their life, their experiences. But since you haven't experienced it, you wouldn't know the intensity. So now in her situation, she doesn't know why everybody in her community are removing teeth. So, but growing up in those places, she saw that when there was a dental pain, the next thing she would look up at these all grown ups, they would go and remove their tooth. She has hardly seen anyone doing a root canal treatment. So if everybody's doing something, and when you grow up, and I guess that's a lot of things in our culture that we do, if you start questioning it, probably, you'll be thrown out of that place because it has become the new norm. And that's the norm for her. But what she doesn't understand is that maybe the reason why everybody was removing, because back then there was not enough support. And it was much easier to get a tooth removed. It was the only option, maybe. It was a quicker option. But now Australia is doing way more. And they're closing the gap. And with that kind of approach, what Australia is doing at the moment is we're talking about different pathways. So we have different treatments that can be provided. There's different clinics. Like there is a company that we're partnering with as well in Queensland. So they have like a chain of clinics, about 10, 12 clinics. They only treat Indigenous people. Nobody else would go in those clinics. So they have their own clinics, or even if they go to the hospitals, they would get free treatment if they need any emergency treatment. Let's say if I'm doing any pulp extirpation today, no charges. General dental care, denture care is free. Now, but what if this patient needs a specialist care, which is possible in her case if we won't go with surgical extraction? Now, there will be a cost, but not as much as no other individuals would pay. And also with specialists, there's going to be some amount of wait time, but not a lot. So that's the benefit that she would get from where she is. Now, the issue here is what this case. Now, her two concerns were, one, I was worried about OAC, and two, I was worried about hepatitis C and HIV. Now, hepatitis C and HIV, these are bloodborne viruses, and this only happens, the risk is high when you do exposure-prone procedures. Now, if you look at it, both concerns are directly linked to extraction. It's directly linked to why is she removing it? Right? I will explain. Yes, we have to talk about OAC, but the main issue here is she needs surety. She wants to know, is there a way you can avoid the risk altogether? Can you bring the risk to zero? No. Neither me or the specialist. OAC can happen with me or specialist. We take extra precautions. We make sure that we follow high standard, but there are always breaches. It can happen, right? And if she really is that conscious, could we use this as a motivation? Could we use this fear and just kind of revisit towards the end and say, look, Terry, look, since that, if I wasn't able to remove this tooth for you today, and if you were to see a specialist, look, I'm happy to just remove the nerves, temporize this tooth for you. And then I'm going to put that referral in. And I will also give you some information about saving the tooth. Now, this tooth is savable. You don't have to remove it. And that's the only way we can avoid those two concerns that you have. But if you still decide to continue removing this tooth because, that's what everybody has done in your community, I'm happy for you to proceed with that. And I've explained everything to you already. Do you get it?
Yeah.
That's the end note. So starting out with knowing in the beginning, I want to know couple of information from this patient. So in cluster 3, make sure, even though if the diagnosis is given, please make sure never start with diagnosis. Never. Because when you do, then they're like, oh, what is that apical periodontitis? What do you mean by that? This is the first impression with the examiner, and we call it golden minute. 20-second is your, 40-second is patient. Do not go 20-second over. So no matter what I've done, I'll just say, all right, now Terry, I had a look inside your mouth, and I was looking at this tooth that you were mentioning earlier about causing pain. So, which is why I took this X-ray so that you and I can have a look at it and decide on what we can do best to get you out of pain. So Terry, now, do you have any questions for me at this point of time? Anything you would like to ask? You see, this is right in the beginning of the OSCE. I'm just telling her, tell me, what concerns do you have? Giving them space. They love it. This is what I talk about, the X factor, the global marking. All right, just slight tweaking things here and there, get them to see who you are. So patient says, well, not much, doctor. I was just thinking, if you could remove this tooth because it's been very painful for me, and I haven't had a good night's sleep for past few nights. And then, okay, conversation has started. So it's all right. No, Terry, well, look, I'm sorry if you had to go through this pain, and you mentioned that it's been affecting your sleep as well, right? So have you been experiencing pain on biting as well? Patient said yes. Okay. Well, see, Terry, let me show you here. So you see that shadow here? So this is the hole, or we call it cavity, through which the bacteria inside your mouth entered inside the tooth. So it's irritated the nerve. And right now, the tooth is dead, it's infected, but the bacteria are still within the tooth, inside the tooth, and the areas around, which is outside the tooth, there's still, your immune system is holding it back. So we call this as acute apical periodontitis, which means inflammation around these areas, tip of the tooth, and tooth is infected. Now, any questions up till here, Terry? So what were you thinking, we may do for you today? And, you were mentioning about some concerns that you had earlier. I'm just, again, giving her space. What does she want? So that I can get to that question, why does she want to remove it? And she says, well, look, doctor, I guess, the main concern that I have is, getting this tooth removed. And, My sister had a tooth removed and she ended up having a hole in that area, so which is what I'm worried as well. Now, this is a good starting point. So I'll say, well, Terry, thanks for sharing that information with me. Well, I guess what you're referring to, I'm happy to show you on this X-ray. I'm sure you would know we have these sinuses here, as you can see. This is the space that we have above the tooth. And so what your sister might have experienced is like a communication or hole might have developed between the two, which can happen sometimes when we remove the upper teeth. We call this oroantral communication. Now, Terry, just along that note, I wanted to ask you, like, why do you want to remove this tooth? It just, out of curiosity, I wanted to know. And patient says, well, it's just because everybody in my community does that. That's if I've seen them in pain, they remove it. Okay. And I'll say, so like, did you have a question or like, do you know, is there any specific reason why everybody would remove it? Patient says no. Okay. Now, the reason why I was asking that question was because if you look at this X-ray, now there is this line that is going, right? So in your case, I would need another X-ray for sure, because sometimes it's a 2D image of a 3D object. So I want to see if this just is a superimposition or actually the tooth is sitting inside the sinus, because that will really impact our decisions. Now, if I were to remove this tooth, there's a couple of things we have to consider, okay? One is to make sure that, if a communication does develop when I remove a tooth, I need to make sure I examine the area and, make sure that there's no communication, because if it does develop, our management could vary. Now, would you like me to explain you how would we know and how we would manage? Patient says yes. Okay. So normally when we remove a tooth, the first thing we do is we examine the root tip to see if there's any bone attached to it. If there is, it's a sign that a hole is there. Two, we examine the socket where the tooth was sitting. If I can visually see the space. The other way we would know is if it's really, really small, you might not be, the hole or the communication might not be visible, but you might see air bubbles into it. And sometimes we might also take some small x-rays as well. We call it a periapical x-ray. And you might see disruption in the lining in that area. But again, it only becomes visible if this hole or the OSCE is bigger in size. But to be more precise, CBCT, which is a 3D image, usually done by specialists, is the one that would accurately tell us about the sizes. Now, our management is really depending on the size. Now, would you like me to explain you more about that? And patient says, yes, doctor, could you please explain it to me? So what we need to do is guide this patient. So in TG, this is what we used to follow. Let me open from TG. So in TG now we're talking about different types of communication and how we're going to do it. Sorry, I'm just going to always see. Yep, it's here. So they want to know, number one, how would you know as a patient, as a doctor? How would I know as a patient that a communication did not close? And if a communication does develop, how would you know? How would you manage? This is like these are assessment questions here. How will you manage it? So the management will depend on the size. So first thing we would do is we would place some stitches, and then we are going to be place a gel inside it. If it's less than 2 millimeter, put a stitch on top and give you instructions to follow for the next 2 weeks, like avoiding any sort of pressure changes between your mouth and your nose, like blowing your nose, drinking through the straw. If it's more than 3 millimeter, now it may not close and it would require surgical closure, and we may have to refer you to a specialist for that. So how would you know that if it has closed or not? So the way I would know, you would know, is if you notice the fluids are escaping from your mouth into your nose, or from the air coming down, you have pain, blocked nose on one side. These are all signs that it did not heal and a communication is there. Now, the next question is, then who's going to be removing this for me if you're not going to do it? So If I can't do it, then I'll refer you to a specialist. Now, then they want to know, how will a specialist remove the tooth? And if a communication does develop, how are they going to manage? So the way the specialist will remove it is by going with this surgical approach, as you said, sectioning the tooth, avoiding those upward forces and remove it. And if a communication does develop, they might stitch it then and there and close it. But the only problem is from now until you see a specialist, there will be wait times. I can look up and I can check if you can be prioritized or if you can be given some discounts. There's different programs run by the government because you're working in a public hospital, scenario says. So then I'll pause. So what questions, like I said, they want to know is, how will you know OSCE? How will a patient know about the OSCE? How will you manage OSCE? Less than 2, more than 3. How will a specialist remove the tooth? How will a specialist close the OSCE if it does happen? Would you be giving this patient an antibiotic if OSCE is 3 millimeter? They want to know about it. So I wouldn't unless a specialist. I'll be guided by the specialist. All right. So you're not going to be just giving it on your own. And then they want to know now, okay, once you've answered all these questions, then given her background, so we'll say that there could be different programs. I'm happy to look up to see if you can be prioritized. I mean, who doesn't want a VIP treatment? Or you can be given discounts. And then the last thing I want to know here is, sorry, just sorry, I just had a call. So now what I would want to do is, now the next thing is, we say, now patient wants to know about infection control. Now you've done this part. These are 5 assessment questions done. Now they want to know, okay, so doctor, I'm also concerned about the infection control. I'm worried about. Now you need to ask them. So, okay, when you say you're concerned about it, so can you elaborate more on it? What worries you? Now she's coming from a health perspective because she said there have been some breaches, and she specifically is talking about 2 viruses, hepatitis C and HIV. There is no vaccination for these, so I'm glad that you didn't talk about it. In this case, don't talk about PPE. PPE is to protect you. So everything that you're talking from that perspective, from these 2. So you need to tell them, you say, all right, now, Terry, look, your concerns are valid, and give yourself about 1.5 minutes. 1.5 minutes is good. So when you're practicing, just put a timer on and do it. So you say, now, Terry, well, look, thanks for sharing your concerns. And yes, I did hear about those clinics as well. And unfortunately, it happened in our very local community. This is why here in our hospital, we take it very seriously. So we follow the guidelines provided by the Dental Board of Australia. I'm happy to give you a copy of guidelines. Regardless of the patient's background, we treat each patient the same way. We have the highest form, which is the standard precautions for all of our patients. And those 2 specific viruses that you refer to, these are bloodborne viruses, I'm sure you would know. And these usually can cause problems when we do exposure-prone procedures, surgical procedures, or when we're handling the instruments as well. So would you like me to walk you through how we manage it? Patient says yes. Okay. So the instruments that we would normally use, normally, we keep it in that dirty area. I'm happy to walk you. We've got a stereo room where the first thing we do is, once the instruments are there, it is categorized. We call these ones as critical instruments. So all critical instruments are packaged individually, and also make sure that we chemically disinfect them. And then when we package them, each one has got a badge identification number. We put these chemical indicators inside and outside to make sure before it goes into the autoclave. Everything is documented, every cycle number, it's connected to you. And once these are cleaned, autoclaved, we store them. And then before we even use it, so when do we open it? We open it at the point of use, which is right in front of you. And that's what I was asking. How would I know? I'll open it in front of you. You can see the color changes. It will tell us if it's been sterilized or not. But let's say for any reason, if there was any breaches, we can always trace it back as well. And again, sharps handling, we use single instruments, like, single-use instruments. So what they want to know is some keywords. The keywords they want to know is standard precaution. Okay. 2, they want to know which category does it fall. These are critical instruments. All critical instruments needs to be packaged. They want to know about batch control identification. They want to know about the chemical indicators, autoclave, how they are documented, and would you be opening it behind or would you be doing it in front of me? So we open it at the point of use. And last thing is sharps. How do you handle sharps or single-use instruments? So that's what they want to know. So if you 1.5, 2 minutes is good. Once you finish, then we go back to the most important thing, which is what are we doing today? So we say now, so Terry, so this is why, we would make decisions. So let's say if I wasn't able to remove this tooth for you, and I would be referring you to a specialist, so there would be wait times involved, and I don't want you to be in pain. So one option is, at least for now, I can remove the nerves, I can temporize it for you. At least that should give you some time, to get on with your work, and at least, there's no risk of infection spreading. Or option 2 is, I'm happy to give you antibiotic, but I can just give you for 5 days along with painkillers. Again, I would recommend nerve treatment, and maybe this could be a moment for you to decide, because everybody in your community was removing, and maybe I'm just assuming could be because back then there wasn't enough support, but now we do, and your tooth is restorable, Terry. So I'm just giving you these brochures. If you do change your mind, there's options of saving this tooth. So do you see? So along that note, you're going to end this discussion. That is the main takeaway, a sense of this case. Education. All cases are about educating the patient. Any question?
Dr. Nazia,
Yes.
what's a public hospital in Australia? It's a private hospital. Don't they have free treatments there for Torres Island?
So very good question. So we have public hospitals and we have those private hospitals as well. So in the exam, mostly we're dealing with public sector, right? And there's quite a few different hospitals. I'm mostly called Royal Dental Hospital of Melbourne. So this is the one that I mostly code. I love their guidelines, DHSV. And if you go here, they talk about fees, they talk about different communities. So here, and they said you are working in a public hospital. It could be any of these. There's Dandenong, there's Monash, there's quite a few. Okay. So this patient
A
will
Royal Dental Hospital is not a public hospital, right?
see again, it's not a public, but the thing is that you see people who do not pay fees for the dental treatment. Look at this.
Uh-huh.
You see, so they come, their services are integrated. These hospitals that are bigger, so there are quite a few hospitals as well. They have this kind of, like when I go to a hospital here in Brisbane as well, if I'm a private patient, then it's still the same hospital, right? But then I can use my insurance. I can go in a private section. I'm seeing the same specialist. This is the same specialist that is dealing with the public patient and the private patients.
Mm-hmm.
Get it? So that's where we're looking into. In the exam, it's clearly mentioned on the screen. You are working in a public hospital. Do you see? It's the top line here.
Okay. Yeah.
It's mentioned. 2 versions we get. If it's mentioned, then it is public. There is no doubt about it. Or the other version is, it's your clinic. Now, your clinic is private.
Okay.
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 So the public
Just one
version is more. Yeah.
Sorry.
I'm gonna go on.
Just one more question. You asked me, what am I going to do today? So if I'm going to temporize it by removing the pulp, there's no need for antibiotics. Otherwise, if she opts for no treatment today, then I'll have to put her on Amox and metronidazole if I'm right.
Yeah, this is like any of those. That's why I made these flow charts as well for you guys. It's like, when do we give? So any localized infection that you cannot provide them treatment. So I am recommending pulp extirpation, pulpectomy, option 1. which I would recommend. But if a patient doesn't agree, then option 2 is I'll give antibiotic, but the limitation is 5 days.
Okay, thank you, Dr. Nazia.
Right?
Dr. Nazia,
Yes.
should we give her antibiotic prophylaxis because she's a Taurus Islander?
No, that guideline has changed long ago. Don't bring that in.
Okay.
They don't ask about heart or this and that. That's all fine. It's not, in this case, there's no connection of that. Yeah, some versions, I would also check if she, because I'm dealing with extraction, I'll ask her if she is smoking or ever smoked in the past. That's should be a routine question in all extraction cases. And she does say that I used to smoke, but I quit. And what is the significance of that? Any idea? If somebody quit, ignore it.
No, she's more health literate now, isn't it?
A change in
Yes.
beliefs is possible.
Yes. So that's very important. Exactly. So we want to know, where did that decision? I mean, it's very good. I would appreciate. I said, well, that's amazing, that you decided to quit. But I just want to know, out of curiosity, what led to that decision. And then that's where she says the reason for that was because where I used to live, it was the norm. Everybody would smoke. But when I came to Australia to study nursing, I realized it's not good, so I quit. So that means she's already questioning the social norm. She's already on the path to change. So maybe, she might as well decide to save the truth. She doesn't have to. But the only advice I would give is don't force. Now, when I say the main essence, some people then they keep convincing this patient, oh, save the truth, and the entire discussion. No, you still have to talk about OSCE. Infection control is extremely important. And just towards the end, that's like 30-second brochure, a small comment, and that's it. Don't drag it. Okay. Any other, but if you get an irreversible pulpitis version, then no need for antibiotic. Again, the options are the same. Either today I can do pulpectomy. Option 1, temporize the tooth, get this patient out of pain, and give painkillers. Or option 2 is just painkillers only. But that again, take it for 5 days. So I would give her options to see what she decides. There's also a version where patient has financial. Sometimes it's, financial as well. And financially, the reason why she wants to remove it, then guide her, being from indigenous population, there's a lot more support. I wouldn't directly ask her. I know in the forms here, it's mentioned in Australia, when you go here, they say, how do you identify yourself? In the forms, it directly mentioned, are you from Torres Strait or, but when you ask somebody, you just have to be very careful with that. It's like asking about somebody's race or where they come from. You're walking on fire. So we just be careful with that, how you ask. Any question?
Yes, would you please, it's not clear to me yet, when the scenario says you are working in public hospital, what is the impact for that? It's not clear to me. I'm sorry for that.
So the main impact, it's a good question you've asked. So the main impact is in the public, who's going to be paying? So remember the ADC examiners, not only they're testing. So from a knowledge perspective, they want to know your understanding about OSCE, HIV. And from a government support, from policies perspective, they want to know, do you know how these individuals in these communities are supported? So if you're in a hospital, so today when you temporize the tooth, there's no charges. You can do it free of cost, or even root canal if she decides to continue. But if she decides to see a specialist, or we are referring, she would be prioritized. And specialists are in the hospital as well. I'm talking about the same hospital where we are, but there will be wait time. Versus the other version where they say you're working in a clinic. No, your clinic is not funded by the government. You will charge the patient, right? So, and the way we would normally charge is, so there's 2 types of vouchers are given. So not all clinic accept, but there are some clinics they do accept these vouchers, depends on the demographic. So normally these patients would be going to their own community clinics or hospital. If they cannot provide them treatment on the same day or they're fully booked, they normally give them vouchers and send them to private clinics. Now, in private clinics, some clinics, like one of the dentists I was speaking to, she was like, we get a lot of these patients, and normally they would charge 600 to 700 for surgical extraction. But when these patients come with voucher 240, she's like, it's just the policy we have, we just honor it, even though the work is way more and charges is 6 to 7, but we accept that. We don't ask them for a gap fee. But there are others where they would take the voucher and then they will ask them to pay the gap fee. So this is where do you stand, as a private owner or working in a hospital is the fee. Okay, do you get it?
Yes, Dr. Nazia, but I just want to ask if the patient either she wanted to remove the tooth or to save it by endodontist. Like in the both scenarios, we need a specialist, isn't it?
Not always. You are looking at the scenario. No, again, that's a good question you've asked. So I'm going to go back. So look at the scenario. You see all these 4 versions. You have to see what version you get. The first thing, when I look at the scenario, I will look at it. Where am I working? Okay, I'm in a public hospital. The next thing I'm going to look at what's the diagnosis they've given. Oh, it's acute apical periodontitis. Okay. Third thing, I'm going to be looking at it. Have I decided on sending to a specialist? Or have I just decided on removing the tooth? That's important. Now, in this version, you've decided to refer already, right?
Yes.
Now, the decision is made. I will still explain the same way. Like I said, I say, well, look, Carrie, if we were to remove this tooth, there's a few things we need to consider. Now, with me, there's a couple of complications that are literally a bit more higher, and then I'll explain OSCE the way I did.
Yes.
The only difference is I will not repeat the X-ray because the decision is made, right? Now, next version, public hospital, acute apical periodontitis. So here it only says decided to extract. Now, who does it? It's not mentioned, right? So then this is where I will repeat another X-ray. And then based on that X-ray, the decision will be made whether I will do it or a specialist. And I will explain again, same thing. If I did it, OSCE risk is there, how I will manage. And if I refer this patient to a specialist, this is what a specialist will do. So the decision will be based on the X-ray. Okay. Third version, we have again public hospital. That's how they do in the exam. They subtly change the scenarios, and you guys think it's the same. Now the diagnosis is pulpitis. All right. Diagnosis changed. Fourth version, it's a private clinic, and it is pulpitis. And now you want to remove it because you can't afford it. You see that?
Yes, doctor. So we can, in this version, we cannot attempt it, right? I'll take an X-ray. If the sinus moved away, I can attempt it. But if the sinus is still there, the root is very close to the sinus, then we still have to refer for a specialist, and she still have to pay for the specialist, isn't it? Right?
Then I will refer her to a public sector specialist where the fee will be less and she will be prioritized.
Okay, that's good. Yeah. Thank you so much, Dr.
Nazia. So main thing, these patients, they will get the high standard care better in the public sector. So we need to redirect them back into the public system.
Yes.
Dr. Nazia,
For explaining those four versions, now it makes sense. Thank you.
No worries. Yeah.
Dr. Nazia, I'm sorry, just one question. I really cannot find the reason behind them putting public hospital there. If you can just redirect me to some article, I can read it and get back to you so that I don't waste your time.
So, why would they put a public hospital for us?
Yeah.
So
What's
again,
there?
so the main thing is they want to know what do you see? I'm going back to this Royal Dental Hospital. It says the Royal Dental Hospital of Melbourne accepts referral from external public and private health practitioners, internal referrals, right? So these hospitals, they have specialists, they have staff, and they have different pathways for these patients, right? So the main thing is, do you see, our job here is identifying which category does this patient belong and how is the hospital where I'm working will support these patients. This is your cluster one. Sorry, this is, if I go back to what domain are they testing you is this one, number one. You see this category. It says number one is identifying your social and professional responsibility, provide culturally safe care to diverse groups of population responding to their distinct needs. Yeah. So they want to know, do you understand? I would recommend this should be on the portal. It's called Referral to the Royal Dental Hospital, Melbourne. All right.
Okay.
It's a very extensive 21 page, but beautiful article. It explains beautifully about the pathways. You see?
Okay. Yeah.
It says
Thank you.
eligibility for special services applies to patients eligible for public dental care who also meet the clinical criteria. Okay.
Okay, thank you.
Dr. Nazia, one last very quick question. Thank you. In the slide of the versions, it says that in acute apical periodontitis, we do pulpectomy or antibiotics. In which case do we give antibiotics where we don't do any treatment today, or what's the antibiotics about?
So, like acute apical periodontitis is
Yeah.
a terminology when we use that means the tooth is infected, the
Mm-hmm.
periapical is inflamed, right? So
Mm-hmm.
then it goes into the category of localized odontogenic infection,
Yeah.
right? So, and the protocol that we have for localized infection is if you can do a treatment within 24 hours, no need for antibiotic, but if there's a delay, you need to give. So that's the option we're giving to the patient. Remember, this patient was adamant about removing the tooth.
Mm-hmm.
So we say option one is that we can temporize it. If we are referring you to a specialist, because I don't expect the specialist to be doing this procedure for you today. And I don't expect the specialist to see this patient today.
Mm-hmm.
Or option, which would be better, or what if the appointment comes in 2 weeks? We don't know. Or option two is we give you antibiotic because I understand the tooth is infected, it's localized infection. But the limitation with antibiotic is the maximum we can drag is 5 days. And I don't know if you're going to get an appointment in 5 days.
Mm-hmm.
Right? So we
Yes,
always
so
give patient range of options. Now they're not expecting us to talk about do nothing or RCT. They want us directly jump into extraction. But then
mm-hmm.
this is where we're giving them options.
Okay. So the antibiotic will be the less preferred option. Like our preferred will be temporize it and then try to find an appointment with a specialist if we cannot do the extraction, right?
Yeah, antibiotics are never a preferred option. It's just, when you cannot treat the patient, that's the only option, then yes.
Yeah. Okay. Thank you.
All right. So all three cases, if you see, I focused a lot on the patients. I focused a lot on the patient stories, who they are, how do they think, what's going on in their life. That is extremely important. And it's a good idea for today, as we discussed. I want you to read about teledentistry. I want you to read about Aboriginal people, their distinct needs. I think ADC has also shared. Also, read about this hospital. Like I said, once you read this document, it will solve problems with many different cases. I mean, it's just, it also talks about different referrals. Also, it's a good idea to read about, payment gateways. How does the government support those that cannot afford it? Those, what are the different types of cards, voucher systems they have in Australia? I think there should be some pathways for that as well. Let me see. Dental services in Australia. So you can check as well, because again, it's good. The more you are making yourself comfortable with the health system, the more easier, because the next step after this is you're working in a practice. So it's a good idea to know how does the health system in Australia work. And you can see local hospital networks where they have these communities, there's different clinics working under them. Where does the funding come from? Right? So there's private, public, veterans, child benefiting, concession or healthcare cards. So just and then in the OSCEs, you just have to work around, okay, this patient, I'm going to give this option if they're struggling financially. Okay, financial is a big issue. Right, that's about it, I guess. Any other question? Yes, sure. For sure. Mm-hmm. Yeah, so they're not, I mean, you can say towards the end that, look, what I would also do is, today is just, do some detailed gum examination before I make that referral. But the main thing is what they're expecting from you is, number one, do you know what are the different ways? Let's say you are in a dental van, you're someplace where you don't have access to the charts. Would you be able to stage or grade it? So that's what they're testing us, right? So periodontal examination or charting is not the only way to do the staging or the grading. So they're looking at, do we understand the other criterias? And two, if somebody comes with stage 4 grade C, they are expecting, do we know the different phases of periodontal treatment? Phase 1, phase 2, phase 3. That's what we're having conversation with this patient. Well, I mean, from what I gather, like the candidates when they told me, I mean, on the maxilla, you might see something like this, but if you look at it, that's more like a stage 3, isn't it? Look at these ones. But is stage 4 is like a really worse form. We're talking about like multiple bony defect. We do see bone loss in the top jaw as well, for sure. But I guess, they're very smart. The one they're giving, you wouldn't see more than this in the top jaw. Now, the difference between this case and the other case that we have, again, this is what I do in the classes, I just make differentiations. The other case that we have very similar is Mrs. Louise. This is the quick set, if you look at it. In Mrs. Louise, there is no bone loss. But what they've done in Mrs. Louise's case in quick set, they gave us a perio chart. This will be there on the table. So if I have done it, they will give it to me. Versus in Mrs. Boldowski's case, they didn't give us anything like this. Right? Now, what's the difference between the two? The difference between the two is both are 55 plus, but yet in Quake said there's only one tooth that is mobile, but yet the chart is showing me that back teeth also has deep numbers, but yet I don't see it. And when you ask the patient, do you have any other teeth that are more wobbly? Patient says no. So if these teeth are not wobbly and the numbers are high, this is the most important clinical indicator of osteoporosis. Osteoporosis, before you see the bone loss, you see the clinical attachment loss first. All right, that's the sign. So that's why they gave us perio chart and they gave us this. So I'm diagnosing the reason for periodontitis was osteoporosis. Now, in Mrs. Bolowski's case, they did not give us a perio chart for a reason, and they're just giving us this. But you see that when you ask, patient will say, yes, I've got many teeth that are wobbly. Even if I can't see it, they're saying, I have many teeth wobbly. So you know that, okay, this is buccal bone. Maybe it's on the lingual. I can't see it, but patient is saying it's wobbly. Right? And then in that situation, I'm suspecting diabetes. You get it? Diabetes caused gum disease. All right. All right. So I guess that's it. So next week we're doing module 5 or NSET, again going as per new. Antibiotics, I'll be catching up with the candidates who recently had that in the exam to see what changes are there. And now, of course, next week we'll go with the latest updates according to the exam. Just make sure that you go through it. Make sure you look at the antibiotic section. We'll be uploading these flashcards as well for you to see. And then, yeah, we're just going to have the discussion. All right, thanks everyone.